Good morning. I'll call to order the October 5th, 2021 meeting of the Santa Barbara County Board of Supervisors. Madam Clerk, please call the roll.
Supervisor Williams,
Here.
Supervisor Hart,
Here.
Supervisor Hartman,
Here.
Supervisor Lavanino, Chair Nelson.
Here.
Let the record reflect that Supervisor Lavanino is absent for this meeting today.
All right, thank you. Next item of business is the approval. Oh, sorry. At this time, please stand and join the board in pledging allegiance to the flag. Ready, begin. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. At this time, the next item of business is the approval of the minutes from the September 21st, 2021 meeting. Can I get a motion?
Move approval.
Second.
All in favor signify by saying aye.
Aye.
Motion passes unanimously with all members present. All right, Madam Clerk, are there any announcements or changes to our agenda today?
Chair Nelson and members of the board, I do have a couple of quick announcements today. I would like to remind the public that the Board of Supervisors meetings are being interpreted and broadcast live in Spanish. We are broadcasting our meetings in Spanish, both for Cox Cable subscribers in South County, as well as Comcast Cable subscribers in North County. Members of the public can now view our meetings in Spanish by turning on the secondary audio programming, also known as SAP, under their language settings. Lastly, I would like to remind the public who are participating in our meeting today of the board's updated methods of public participation. For the Board of Supervisors methods of public participation and to provide public comment on general public comment or an item on the board's agenda, please see page 2 of the agenda. Members of the public can now attend meetings in person in both the Santa Maria Board Hearing Room chambers as well as the Santa Barbara Board Hearing Room chambers. Please note, on September 5th, 2021, a new county health officer order went into effect requiring indoor mask usage for everyone over 2 years of age, regardless of vaccination status. If you attend the board meeting in person, you will be required to wear a face covering or mask at all times, regardless of vaccination status. Information regarding how to properly wear a mask has been posted throughout both locations. As a friendly reminder, masks should cover your nose and mouth. Wear the mask from the bridge of your nose to all the way under your chin. Tighten any loops or ties so the mask is snug. If you do not have a mask that fits properly, we will provide you with one. Individuals that would like to provide verbal public comment virtually may do so via Zoom by registering in advance via the link available on page 2. After registering, you will receive a confirmation email containing important information about joining the virtual meeting. Once the chair has announced the item you want to comment on, please join the meeting with the information provided in the registration confirmation email. You'll be placed on mute until it is your turn to speak. The clerk will call you by name. When removed from mute, you will hear a notification your line has been unmuted. If you are using a touch-tone phone, you may need to press *6 to unmute yourself. Each person may address the board for up to 3 minutes at the discretion of the chair. If you have any questions, please contact the clerk of the board's office at 805-568-2240. And that concludes my announcements for today.
Thank you, Madam Clerk. The next item of business is the County Executive Officers Report. CEO Miyasato, do you have anything to report today?
Good morning, Chair Nelson and board members. I have 4 quick announcements, and then I'll hand it over to Vaughn Dovernosa, our Public Health Director, and Dr. Ann Sorg, who are here to give flu shots this morning. So first of all, just a reminder to the public that the County Emergency Rent Assistance Program is available to qualified tenant households in Santa Barbara County dating back to March 2020. It's administered through the United Way of Santa Barbara County. The requirements in the application are available at unitedwaysb.org/rent. unitedwaysb.org/rent. You can go on the site and check the status of applications already submitted as well. Second issue is that the Citizens Independent Redistricting Commission has less than 3 months to complete new boundary maps for the county supervisorial district boundaries based on the 2020 U.S. Census and community input in respect to neighborhoods and community equity. The public is invited to the next meeting, which is tomorrow at 6 p.m. at the Joseph Centeno Betaravia County Admin Building at 511 East Lakeside Parkway in Santa Maria. And for more information, you can go to drawsantabarbaracounty.org. That's drawsantabarbaracounty.org. Third, Central Coast Community Energy, also known as 3CE, begins service for the Southern California Edison Territory in South Santa Barbara County this month. Enrollment is open through early December. Customers in PG&E's North County service area began in January. Service for Buellton begins in January 2022. The public is invited to learn more at 3cenergy.org. Fourth, the Tri-County Regional Energy Network, or 3C-REN, is launching the Multifamily Home Energy Savings Program with a public webinar on October 12th. The program will provide rebates for whole building energy efficiency upgrades to buildings with 5 or more units. Property owners and contractors can register for the launch at 3c-ren.org, 3c-ren.org. And that concludes my announcements, and I'd like to now hand it over to Dr. Dorenoso.
Good morning. Let me start over. Good morning. Thank you for allowing Public Health to be here to start off your day. We are initiating our annual flu campaign, and with us today is Kathy, our immunization coordinator, and Sarah, a nurse in our immunization program. And with that, I'd like to invite Daz and Greg to come down for your annual flu shot. So what we typically do is we will take photos and use this as a photo op to really push it out on our social media, encouraging all members of our community to get their flu shot. And flu shots are widely available anywhere in the community. There's a new feature this year where there are walk-in appointments as well as scheduled appointments. And you can go on to myturn.ca.gov and select either the flu vaccine or the COVID vaccine and where you live and whether you want to walk in or whether you want to schedule an appointment. It's a really easy process. The flu vaccine is free and is covered by most private insurance as well as covered by Medi-Cal and Medicare. And the Public Health Department will be hosting community flu clinics on a smaller scale, not in a mass pod venue like we have done previously, but we will be partnering up with community organizations and offering it in congregate living centers, in high-density living situations, in combination with our COVID-19 vaccine as well.
And board members and supervisors and anyone in the audience, including a couple of department heads I see, they do have enough flu vaccine. If anyone would like to do that after this presentation, and I think Public Health will set up in the large conference room.
Thank you, Dr. Reynoso. Supervisor Hartman?
I just had a question, but I'll wait till the photo op is over. She didn't want that. You knew that. Maybe I could ask my question of Dr. Ansorg, and that is the flu vaccine a one size or one shot fits all, or are there different kinds of flu vaccines? Good. So that's you advise that it's not. Okay. Thank you.
Thank you, Supervisor Hartman. Thank you, Dr. Ansorg. All right. Xiaomi Asada, are there anything else?
No, thank you, Chair Nelson.
All right. And thank you, Public Health and the public in general for indulging us while we made that special announcement or that special presentation. The next item is the approval of the administrative agenda. Do any board members request to pull any items on the administrative agenda? All right.
I just wanted to note about A22. This is the grant for vessels, and I'll let the clerk read it.
Great. And I will be pulling A15, 16, 17, and 27 for a separate vote. With that, Madam Clerk, do we have is the public pulling any items today?
Chair Nelson and members of the board, I have no requests from the public.
All right. So at this time, if I could get a motion to approve the administrative agenda with the exception of items A15, 16, 17, and 27.
So moved.
So is there a second?
Second.
All in favor signify by saying aye.
Aye.
Motion passes unanimously. All right, Madam Clerk, will you read item A15 at the record?
Chair Nelson and members of the board, administrative item number 15 is from Human Resources. It is to consider recommendations regarding an Engineers and Technicians Association, ETA, successor memorandum of understanding.
All right, thank you. I pulled this item, and my comments I'm going to make here would apply to all three of the items, but it's been previously a longstanding practice of the 4th District to pull and vote against employee contracts. I want to take this opportunity to explain both my support and reservation for these raises. Some like to argue that county employees are paid too much. I do disagree. Many of our employees are highly trained, highly educated, and have chosen to invest their time and talent in county employment. The county offered a job and at a salary level, and county employees have chosen to accept it. It's a transparent transaction. As a responsible employer, I believe we have a duty to protect our employees' salaries by acknowledging and adjusting our salaries to reflect inflation. We also should, from time to time, reevaluate issues of compaction, evolution of job duty, and address hard-to-fill positions. These three contracts, A15, 16, and 17, on the agenda today attempt to do that. While I acknowledge our county employees aren't overpaid, I also have to acknowledge that they are expensive. There are many reasons that's true, and it's impossible to compare that to the private sector. So these raises ultimately lead to a zero-sum game in our budgeting process. We don't have the luxury to print more money, so these raises, if they don't keep up with revenue increases, result in one of the two things: higher taxes and fees, or future cuts to services and layoffs. I am concerned with the future property tax revenue and the state and federal government's ability to cover rising labor costs. For this reason, I cannot fully support these three items and will be abstaining from the vote today. So with that, if I can get a motion on A15, 16, 17?
Move approval?
Second?
Any further discussion? All in favor signify by saying aye.
Aye.
Or sorry, no, or I'm going to abstain. Messed that one up. Madam Clerk, actually, we should do a roll call on that. Let's try it again. Roll call vote.
Supervisor Williams,
Aye.
Supervisor Hart,
Aye.
Supervisor Hartman,
Aye.
Chair Nelson.
Abstain.
Motion passes.
All right, thank you for patience with me on that one. All right, Madam Clerk, will you read item A22 in the record?
Chair Nelson and members of the board, administrative item number 22 is from the sheriff. It is to consider recommendations regarding the surrendered and abandoned vessel exchange, Save 21 grant of $25,000. And a 4/5 vote is required for this item.
All right, thank you, Madam Clerk. Supervisor Williams?
Well, I think we just passed it because we didn't pull it from the
Right.
vote. But my purpose of pulling it was simply to just thank Lieutenant Arnaldi that the coordination with his office, with him and our office and local residents has enabled the removal of several vessels. I also want to thank Heal the Ocean for their participation as well. This has been a good effort of trying to make sure that some of these boats don't end up being a nuisance or dangerous for beachgoers and for local residents.
All right, thank you, Supervisor Williams. I believe the next item on the agenda is item A27.
Chair Nelson, I believe we did pull this item, so if we could do a roll call vote on it.
Oh, all right, just to be sure. Can I get a motion to approve item A22?
Second? Oh, so moved? Second?
All in favor, signify by saying aye.
Aye.
Motion passes unanimously.
Thank you.
All right, moving along, A27.
Chair Nelson and members of the board, administrative item number 27 is sponsored by Supervisor Hart and Supervisor Hartman. It is to adopt a resolution affirming the right of reproductive freedom for the residents of Santa Barbara County.
All right. So this is an item for presentation, and so I think it's going to be read, and then I think we're going to do a presentation. But before we do that, I just, on a personal level, needed to pull this item, and this board has diverse opinions on issues, and there's few issues in society that This is as controversial as this one. I personally, as well as a representative, represent many people who have an alternative view of what reproductive rights mean. I am a proponent of contraceptive care and women's access to health care. I am concerned about what abortion means. And I believe since 1973, when Roe v. Wade was decided by the Supreme Court, that we know so much more about the unborn. And I cannot support this resolution and will not be signing it. So I believe we do need probably a motion, though, to approve it prior to presenting it.
So moved.
Second?
Madam Clerk, roll call, please.
Supervisor Williams,
Aye.
Supervisor Hart,
Aye.
Supervisor Hartman,
Aye.
Chair Nelson.
No.
Motion passes 3-1.
All right. With that, Madam Clerk, will you please read the resolution?
Yes, Chair Nelson and members of the board, I would first like to mention that we do have joining us today via Zoom Dr. Jenna Tosh from Planned Parenthood of California Central Coast, as well as Luz Reyes Martin. And I will now read the resolution into the record. Whereas the Supreme Court of the United States has acknowledged in its 1973 landmark decision, Roe v. Wade, that the ability to make a private medical decision impacting one's own reproductive health is a constitutionally protected right of privacy. And whereas prior to 1973, pregnant people in many states face significant obstacles in accessing safe and legal reproductive care, resulting in widespread loss of life and serious illness. And whereas this historic Supreme Court decision legalized abortion and recognized pregnant people's freedom of reproductive choice as essential to their lives, rights, and health, and contributed most especially to women's struggle for equality. And whereas nearly 600 pieces of legislation attacking and eroding access to safe and legal abortion care and women's reproductive rights were introduced in states throughout the nation in the past year. And whereas in August 2021, the U.S. Supreme Court declined to uphold the precedent set by the Roe decision and allowed the state of Texas to enact Senate Bill 8 into law, which functionally denies abortion access for more than 6 million women of reproductive age living in Texas. And whereas these restrictions, bans, and attacks on reproductive freedom disproportionately affects populations that already face barriers to accessing health care, communities of color, people with low incomes, immigrants, young people, and women with children. And whereas, as states around the country enact extreme laws that violate the fundamental right to decide whether to bear children or end a pregnancy, the County of Santa Barbara can serve as a model by committing to defend reproductive freedom and access to safe and legal abortion care. And whereas prohibitions on the right to safely access a range of reproductive health care services, including abortion and contraception care, are harmful to public health and safety and are contrary to the values of the people of Santa Barbara County and the state of California, which affirmed this fundamental right to privacy in 1969 prior to Roe. Now, therefore, be it hereby ordered and resolved that this Board of Supervisors acknowledges the harm of eroding safe and legal access to reproductive care, including abortion and contraception, and upholds the constitutional rights enshrined by Roe v. Wade for all residents in the County of Santa Barbara, passed and adopted today.
All right. This item is sponsored by Supervisors Hartman and Hart. Would you like to say anything before we go into our guests?
I will.
Supervisor Hartman.
Sure. The Supreme Court is poised to hear a Mississippi case that would overturn Roe v. Wade. And this court has emboldened 23 other state legislatures to enact laws to follow suit, including Texas, whose law creates a bounty system to go after anyone aiding a woman seeking to terminate a pregnancy. And here are just a few facts. Nearly 1 in 3 or 4 American women have had an abortion during their lifetimes, and already by age 20, 1 in 5. The abortion rate, though, has declined since 2008, largely because of sex education and the availability and use of contraceptives. But many of the states that would enact restrictions on abortion have also limited sex education and contraceptive care. 90% of women who get an abortion do so in the first 13 weeks, but the exception is for poor women, which includes women of color. It simply takes poor women longer time to find a place where they could get an abortion, to get the transportation, and to raise the funds. So the impact of overturning Roe v. Wade will far disproportionately affect poor women who won't be able to fly to New York or California. So this is really about reproductive justice. There was a study that was done looking at how abortion affects the lives of women. And it was published and described in greater detail in the Turnaway study, 10 years, 1,000 women, and the consequences of having an abortion or being denied an abortion. So this was done by the UCSF medical school researchers, a 10-year study, and this book embodies some of the findings. When they asked women, those who were denied an abortion and those who actually had one, about the factors that went into their decision, they found that there were multiple factors and that choice shapes the whole trajectory of a woman's future life. Her chance of having a reliable partner, her chance of having a support network to help with the family, her chance of supporting herself and her family, her chance of having a wanted baby later. Recently, 3 congresswomen told their stories on the floor of the House, and they wouldn't be where they are today if they had not had access to abortion, illustrating the very point of the Turnaway study. Representative Cori Bush said, "At 18, I was raped, I became pregnant, and I chose to have an abortion. Choosing to have an abortion was the hardest decision I have ever made, but at 18 years old, I knew it was the right decision for me." Representative Pramila Jayapal, she needed an abortion despite taking contraception when she was a young mother caring for a very sick child and struggling to recover from postpartum depression so severe that she had considered suicide. Her doctor told her that carrying a second child to term would be extremely risky for both her and the baby. And then Barbara Lee, somewhat older congresswoman, she described getting an abortion in a back alley in Mexico at the age of 16 before they were legal in the US, and noted how many women have not survived these. So again, these are decisions that are not taken lightly, and they shape the whole future course of a woman's life and that of her child and her family. It's a decision that a woman, her partner, her family, and her healthcare provider need to make. It is a fundamental right to privacy and reproductive justice. Thank you.
Thank you, Supervisor Hartman. Supervisor Hart.
Yeah, thank you, Supervisor Hartman, for asking me to co-sponsor this really important resolution today. And I also want to thank Dr. Chenatosh and Luz Reyes-Martin, who are here from Planned Parenthood to accept the resolution. This past weekend, ahead of the Supreme Court reconvening yesterday, women and men across the country stood up and marched to send the justices and other lawmakers a very clear message. Alexis McGill Johnson, the president of Planned Parenthood, stated this message so well. Abortion is health care, basic health care, essential health care, and health care that cannot wait. This past Saturday, I joined the women and men of our community at the Santa Barbara County Women's March for Reproductive Rights. As we listened to the speakers before the march, I was struck by a simple fact. We are witnessing the most dire threat to abortion access since the passage of Roe v. Wade. For the first time in nearly 50 years, by failing to take action on the Texas legislature's bill, the Supreme Court has failed to protect the constitutional right to choose if and when to have children. I stand with everyone across the country fighting to protect this basic right to safe and affordable access to abortion, period. We cannot go backwards to the dark days when women were forced to seek dangerous, life-threatening abortions outside of safe and legal clinical settings.
Thank you, Supervisor Hart. Supervisor Williams?
Well, I think that if folks, I want to say that, first of all, vigilantism against women is not the right way to exercise public policy, and that's essentially what the Texas law empowers, is a sort of legal vigilantism where anybody can bring a suit against a woman who seeks an abortion. I think the right way, especially when these studies indicate that a large plurality of an even majority, some of the studies link the desire to get an abortion to economic issues, is economic empowerment, social safety net, access to birth control and reproductive services, and the combination, some of these studies are very indicative that all sorts of sex education actually reduces the demand for abortion. And so I would speak to those that want to reduce abortion. I think that's the right way to do it, through sex ed, reproductive health care, that is birth control, and economic opportunities for women. That has, in the last 2 decades, 3 decades, reduced the demand for abortion in the United States. And I think that's the way to move forward as a country, not as Texas has done.
Thank you, Supervisor Williams. Ms. Reyes Martin, Dr. Tosh, welcome.
Good morning, Chair Nelson, Vice Chair Hartman, and Supervisors Hart and Williams. I'm Jenna Tosh, CEO of the Planned Parenthood Central Coast Action Fund. On behalf of the over 3,000 people who marched in Santa Barbara and Santa Maria this weekend for reproductive rights and access, I want to thank you for passing this resolution. 2021 was the worst year for abortion rights and access since the Roe v. Wade decision. There were nearly 600 abortion restrictions introduced in state legislatures across the country, and 90 of them were enacted. And today, abortion is effectively illegal in Texas, the first time a US state has banned abortion since 1973. Yesterday, the Supreme Court began its new term, and in December, they will hear a direct challenge to Roe v. Wade. If Roe is overturned, 26 states would likely ban abortion before the end of next year. And those states are home to 36 million women of reproductive age and more trans men and gender nonconforming and non-binary people. That means that nearly half of US people who can become pregnant could lose their reproductive rights overnight. We know that Black, Latinx, Indigenous people already face the greatest barriers to getting the reproductive care they need. These bans hurt communities of color most. And 8 in 10 Americans support the Roe v. Wade decision and do not want to see Roe overturned. In the face of these grave threats to our constitutional rights and the dignity of pregnant people, none of us can be silent. And we all must do everything we can to protect safe, legal, accessible, affordable abortion care. So I appreciate your leadership, Vice Chair Hart and Vice Chair Hartman and Supervisor Hart, for affirming your commitment and affirming the commitment that Santa Barbara supports this essential constitutional right. Thank you.
Thank you, Dr. Tosh. Ms. Reyes Martin.
Thank you so much, Board of Supervisors. I will just briefly add again my deep appreciation for your leadership and for taking this step to affirm the values that we share in Santa Barbara County, that we support reproductive freedom, that we support healthcare and access to reproductive healthcare, including abortion. So thank you so much.
Thank you, Ms. Reyes Martin. At this time, we'll take a 5-minute break. All right, welcome back. At this time, we now will go to administrative item number 28. Madam Clerk, will you please read that item?
Chair Nelson and members of the board, administrative item number 28 is sponsored by Supervisor Hartman. It is to adopt a resolution proclaiming the month of October 2021 as Breast Cancer Awareness Month in Santa Barbara County. And joining us today in person, we have Josefa Rios, June English, and Dr. Vondo Reynoso to receive this resolution.
No, go ahead and read the item into the record, or read the resolution, please.
I will now read the resolution into the record. Whereas in the U.S., 1 in 8 women will be diagnosed with breast cancer in their lifetime, and when breast cancer is detected early in a localized stage, the 5-year survival rate is 98% as a result. Women should work with their medical providers to establish a plan to detect the disease in the early stages, which includes regular mammograms, clinical breast exams, and self-breast exams. And whereas healthcare plans cover preventative services such as breast exams, the Public Health Department's Every Woman Counts program provides support for breast cancer screenings and diagnostic services for low-income women who do not have resources for this important service. And whereas in the past fiscal year, Santa Barbara County Every Woman Counts health educators provided 284 tri-county individuals with breast cancer education and referrals to free screenings. In addition, providers whom partnered with Every Woman Counts conducted free breast cancer screening and diagnostic services for 10,042 tri-county individuals. And whereas in the past fiscal year, Santa Barbara County's Every Woman Counts has provided 44 tri-county women with patient navigation services from the program's nursing staff to support patient compliance and eliminate barriers to timely screening, completion of diagnostic testing, and facilitating referral for treatment. And whereas we are in support of Santa Barbara County's Every Woman Counts prevention efforts. Now, therefore, be it hereby ordered and resolved that this Board of Supervisors does proclaim the month of October 2021 as Breast Cancer Awareness Month to promote the health of all residents in the County of Santa Barbara, passed and adopted today.
Thank you. Supervisor Hartman?
I'll go first. Although it affects 1 in 8 women who actually contract the disease, it affects every single woman. I had a close friend whose mother had the genetic mutation and died of it. My friend never spoke of it until she was diagnosed. And then she let it be known that it was too painful and she just wanted to repress it and not think about it. I have many other friends who have been treated and successfully. And so we all need to take this very seriously because the treatments are effective, but we have to take the initiative and follow through. So thank you for all your work on this.
Thank you, Supervisor Hartman. Dr. Del Reynoso?
Yes, good morning. And Supervisor Hartman, through the chair, thank you so much for highlighting this very critical health service that we provide and the need to be proactive in taking care of our bodies. And with that, I'd like to introduce June, who will say a few words.
Thank you, Supervisor Hartman and board members, for this recognition. We are trying very hard to get back to normal. Our activities last year continued to be face-to-face in some of the free clinics that we work in through a unique shared employee thing. I also have wanted to introduce this, and one of our partners, the Promotoris Network. Josefa Rios has been with Every Woman Counts for many years in different capacities, but she's been a trainer for the Promotoris as well as very active in that. So she's one of the key players in Santa Barbara County for helping to spread this information, and we love working with the Health Linkages program.
And on behalf of the Santa Barbara County Education Office and also Santa Barbara County Promotores Network Health Linkages Program, we just honored to receive this recognition, and it's an honor to also, with all respect, and thank you very much for everything that we do.
Thank you. All right, we've already approved that item with the administrative motion. The next item on the agenda, or next item we're going to present is administrative item number 29. Madam Clerk, will you please read that into the record?
Chair Nelson and members of the board, administrative item number 29 is sponsored by Supervisor Nelson. It is to adopt a resolution proclaiming the week of October 3rd, 2021 through October 9th, 2021 as National Fire Prevention Week in Santa Barbara County. And joining us today, we do have Fire Chief Mark Hartwig here.
No.
Next, hold tight one second.
Yeah. That's my fault. I think it's a miscues, and we were done with the admin item, forgetting we had the resos, and he went to get his flu shot. So he'll be right back in a few seconds.
All right. And here he is. Go ahead.
I will
Chief
now
Hartwig.
read the resolution into the record. Whereas October 3rd through 9th has been declared National Fire Prevention Week as a time to reflect on the importance of fire safety education and prevention. And whereas the 2021 National Fire Prevention Week theme, Learn the Sounds of Fire Safety, works to educate children and adults about smoke and carbon monoxide, CO alarms, their necessity, and how the sounds they make help save lives. And whereas fire is a serious public safety concern both locally and nationally, and recognizing and understanding the importance of smoke and CO alarms is instrumental in saving lives. And whereas Santa Barbara County residents who have educated themselves on the proper utilization and recognition of smoke and CO alarms are more prepared and will therefore be able to recognize and react to a potential fire or toxic release of gas in their home or place of business. And whereas the 2021 Fire Prevention Week theme, Learn the Sounds of Fire Safety, effectively serves to remind us that we need to take advantage of the technology afforded to us to safely recognize and respond to fire and carbon monoxide. Now, therefore, be it hereby ordered and resolved that this Board of Supervisors proclaims the week of October 3rd through 9th as National Fire Prevention Week throughout the Santa Barbara County and encourages everyone to participate in fire prevention activities at home, work, school, and all locations, making this Fire Prevention Week the beginning of a year-long effort to improve fire safety, passed and adopted today.
Thank you, Madam Clerk. Welcome, Chief Hartwig.
Thank you, Chair and distinguished members of the board. I just want to make a couple brief comments, if I could, about the resolution you've passed before us. We spend a lot of time, rightfully so here, talking about wildfire preparedness. We shouldn't forget, with all that emphasis that goes into that, to the fires in the home. Often, very often, the first sign that anybody has in a home that there's a fire in the home is a working smoke detector. Now we have technology that would also detect carbon monoxide, which we call the silent killer. Having both of those alarms, working alarms, will save lives. It does save lives throughout the country, and it will save lives in this county undoubtedly. So thank you for your recognition, and I'm honored to accept the resolution on behalf of the Fire District.
Thank you, Chief Hartwig.
And our fire marshal, who I think is still getting vaccinated, but
Chief, can I ask a dumb question? How, in a typical, say, I don't know, 1,500 square foot house, or even maybe a little bit larger for those that have those, how many fire alarms should you have in a home?
every room and in every hallway. And if you're tempted like I am, that when it starts beeping, not to climb up and change the battery because you didn't change it the one time a year when you change the clocks, don't be tempted to remove the alarm. That's the worst thing you could do. And yet often when we're going into homes looking for helping on a medical aid, we see people who have disabled those alarms. So yeah.
All right.
Resist the temptation. Yeah.
I guess try to reinstall some.
Thank you, Chief Hartwig.
Thank you.
Guilty as charged.
All right. So that concludes our administrative agenda. Now is the time for members of the public to speak on items that are not on the agenda today. Madam Clerk, are there any requests to speak on general public comment?
Chair Nelson and members of the board, we have 4 requests to speak under general public comment today.
All right, and before we get started, I just want to remind the public, we do have an item on COVID. So if you have any comments that are related to COVID response, it'd be more appropriate to speak on item D1. Madam Clerk?
Chair Nelson and members of the board, we will begin in Santa Barbara with Caroline Abate, to be followed by Katie Mickey.
Welcome, Ms. Abate.
Hello, thank you. Thank you for the opportunity to speak. Even though COVID is declining in Santa Barbara County, politicians give out new and ever more increasingly severe mandates for injections and masks. Even during public comment, all speakers here must wear a mask. Is this really necessary? Is a healthy person speaking at this podium during public comment without a mask a high risk for spreading COVID to someone else? Have any epidemiological studies been done showing the transmission rate of COVID by a completely asymptomatic person with no mask speaking for 3 minutes during public comment? Typically, coronaviruses are transmitted by airborne fomites, when coughed, sneezed, or breathed out from a person who tests positive. Another person must be in close enough proximity for a long enough period of time to inhale a large enough amount of airborne viral fomite into their own nose or mouth. That's how the vast majority of transmissions occur. Even still, the person may not necessarily become a symptomatic case until the virus comes in contact with their immune system. How many people have coughed or sneezed, and then, because of the mask, their next breath inhaled the virus deeper into their nose and nasopharynx, to the back of their throat, down into their trachea and lungs? In other words, how many cases of symptomatic COVID have been caused through self-infection as a result of wearing a mask, where the person would not otherwise have become sick? Could constantly wearing a mask have a risk-benefit ratio? This mask mandate affects thousands of people here in Santa Barbara County, many of whom wear the mask all day at work, hour after hour, day after day. Is there any data from the County of Santa Barbara Public Health objectively analyzing risk of self-infection from continually wearing a mask? A mask is helpful in some situations. However, it's silly to wear a mask when the risk of spreading any virus to another person is practically zero, while at the same time, the mask may even be doing more harm than good. Thank you for being willing to think about these questions.
Thank you, Ms. Abate. Madam Clerk, next speaker.
We will now go to Katie Mickey in Santa Barbara, to be followed by Dr. Amy Smith on Zoom.
Dear County Board of Supervisors, today we can all celebrate Governor Newsom's veto of SB 556, one of the 5 deregulatory wireless broadband bills. To Supervisor Williams and all of you who asked the governor to veto SB 556, I thank you. Regrettably, AB 537, the fast-track broadband bill, was signed into law, and more broadband bills are waiting in the wings. This bill puts a 60-day shot clock requirement that deems applications approved once the shot clock has passed, unless the county has properly codified grounds of denial and exercised their authority to deny incomplete and unsubstantial applications. AB 537 makes it difficult for local governments to protect safety in the right-of-way. Deemed approved remedies effectively give industry free rein to build on public property. When a local government misses a deadline, the application is presumptively granted, whatever the safety consequences might be. This type of provision has obvious problems for workers and the public. Although the industry would like to make it sound as if deployment is a simply defined grounds of denial, such as proof of significant gap in coverage based on 6 months of drop calls, whether the proposed facility presents a minimal intrusion on the community, whether the applicant has proven based on the evidence presented to the approval authority that there are no potential alternative, less intrusive locations than the site proposed. We currently have 5 Crown Castle applications being reviewed in our county and a code with no teeth. Our review boards are restricted to aesthetic determinations. SafeTech Santa Barbara County has sent you all a federal law-based analysis of the City of Santa Barbara's municipal code. SafeTech SBC, Santa Barbara Permaculture Network, Sweetwater Collaborative, Santa Barbara Green Sisters, Santa Barbara Body Therapy Institute, which includes several thousand constituents, encourage you to read it in its entirety. Time is of the essence to amend our county code, preferably before the first of the year when AB 537 becomes law. We look forward to meeting with each of you to discuss the legal means to codify grounds of denial. Thank you very much.
Thank you, Ms. Mickey.
We will now go to Dr. Amy Smith on Zoom, to be followed by Maria Kastner, who is our final speaker.
Welcome, Dr. Smith.
Hello, can you hear me?
We can.
Thanks. I just, I was a little shocked to see what looked like a product placement commercial for the flu shot this morning, and I'm sure it'll be profiled for free in the news media. And it's a great way to let people know about the flu shot, but who's telling people about the risks of the flu shot? Because there are risks to any medical intervention, and the flu shot has well-documented risks and adverse events and concerning ingredients. And so, this is the same concern that we get to, that somehow we're not being objective, and we're being coerced or pressured into taking the position that promotes the interests of huge corporations that have captured so much of our society, including the media and the educational systems and the publishing of literature, peer-reviewed research, everything. So this is very concerning. And we're talking about my body, my choice, the reproductive rights and medical privacy, but that's not being extended to the reaction and when it comes to COVID. And that seems like a tremendous contradiction. I don't see how people can miss that point. Now we're asking everybody, kids on the Santa Barbara City Council or college campus are wearing bracelets to show their medical intervention status, that they have had a vaccine. That is not privacy at all. So we are just not operating on principle and objectivity and protection of everyone. These things are very concerning. I will talk after the COVID report more detailed about that, but you passed 4-1 a mandate for the workers in our community, for our county, to get this untested gene therapy, genetic engineered intervention that has no long-term safety profile, no cost benefit analysis that people can take and make for their own self. And they have to grovel to have their religious views examined with no privacy for their religious beliefs either. So this is very disturbing. I would just remind you that in the Declaration of Independence, it says we have unalienable rights. And, to take away rights when there's a disease that is treatable, that has lots of treatment options and is not being explored, why don't we have a commercial for everyone come in and take their vitamin D pill and show that that's a great thing to help get your vitamin D status or get it checked to make sure that you're protecting yourself against respiratory illness. You could be doing other things, but everything is being geared toward this pharma agenda that's also towards a vaccine passport and a data agenda and violating our freedoms. And it's up to you. And I'll just leave you with Martin Luther King. Cowardice asked the question, is it safe? Expediency asked the question, is it politic? Vanity asked the question, is it popular? But conscience asked the question, is it right? And there comes a time when one must take a position that is neither safe, nor politic, nor popular, but one must take it because one's conscience tells one that it is right.
That is your
Thank
time.
you.
We will now go to Maria Kastner, who is our final speaker.
Good morning, Board of Supervisors. Can you hear me?
We can, Ms. Kastner. Please proceed.
Okay. I had just a general question, but it wasn't on COVID yet. I have a question about the voter information guide and sample ballot and the fact that this is going to be a vote by mail election only. And I would like to find out from the county, how do you protect our right to privacy, which under the California Constitution, Article 1, Section 1, all people are by nature free and independent and have inalienable rights. Among these are enjoying and defending life and liberty, acquiring, possessing, and protecting property, and pursuing and obtaining safety, happiness, and privacy. How is my ballot going to be a secret ballot? It seems to me that under Article 1 of the California Constitution, I have a right to privacy, which should extend to a secret ballot. And when I looked up Dr. Shirley Ann Weber, California Secretary of State, Voter Bill of Rights, it does say in the Voter Bill of Rights in California, the right to cast a secret ballot without anyone bothering you or telling you how to vote. So my objection is that I did put a signature on an envelope for my daughter who votes via mail, but there was no other envelope where her ballot would basically obscure who she voted for when the envelope was opened, and basically the signature could match with the voting ballot, and therefore it would expose who she was voting for. So that was my question for today. How is the county securing secret ballots in this process? Thank you so much.
Thank you, Ms. Kastner.
That was our final speaker.
All right, that concludes public comment. Next item on the agenda today is Departmental Item 1. Madam Clerk, will you please read that item into the record?
Chair Nelson and members of the board, departmental item number 1 is from the County Executive Office. It is a hearing to consider recommendations regarding an update on the coronavirus disease 2019 COVID-19.
Dr. Rosa, when you're ready. Just hold on one second. I'll make sure we're here. Yeah.
I'm kind of out of practice. This is my first time back in a long time in person.
Welcome back.
So it's good to be here. This morning's briefing topics will include our update on COVID-19 data, an analysis of our 0 to 18-year-old cases, sharing with your board the health officer order for indoor masking, more information on the flu season, and it will end with Mr. George Chapian and the legal aid giving an update on COVID-19 eviction moratorium. Santa Barbara County by the numbers. Currently, we are reporting 34 new cases. This is about a 62% decrease from a 2-week average. Active cases at 356. Our total cases in our county is 42,590. Case rate as of September 30th is at 11.5. Unfortunately, we reported a new death. This occurred to a resident who lived in Santa Maria in the 30 to 49-year-old category. We currently have 44 hospitalized, with 17 of them in the ICU. So with regards to ICU numbers, we are seeing an increase, about 42% in the last 2 weeks. Total death in our county is 505, and our testing positivity as of September 30th is at 3.3. With regards to hospital capacity, as of October 4th, we have 38% remaining hospital beds, and 31.2% of ICU capacity. So this is typical. It's something that we are gauging, and we are in conversations with our hospital partners. And when we look at COVID-19 hospitalization data, we are sharing the differences between the number of unvaccinated and the vaccinated who are hospitalized. So the number from May to August, we had 306 individuals hospitalized for COVID, and 85% of them were unvaccinated, with the remaining 15% fully vaccinated. And this is reflective of trends that were throughout California and in other areas of our country. Vaccination rate, we are inching up our vaccination numbers. We are reporting a 68.9% of eligible Santa Barbara County residents as fully vaccinated. I'd like to share with your board the vaccination rate by zip codes, because it's important to look at the wins in the areas that we have been outreaching, partnering up with community leaders to reach. There are the highlighted areas. So that signifies the 6 zip codes in the Mid and North County that have made a greater than a 0.8% change. So every one person that vaccinates, we celebrate. To put it more succinctly, the greatest percentage increase from previous week is observed in this graph. So we have 4 zip codes covering Guadalupe, New Cuyama, Santa Maria, Sisquoc, and Gary that in the first column, percent change among partially vaccinated, experienced 0.9 to all the way to 2% increase in the number of people who got their first shot. The last column, the orange column, signifies a percent change among fully vaccinated. So again, we're seeing a range from 0.9 to 1.4. And so Guadalupe is our star this week because of all the community outreach and partnership making it happen. And the next would be New Cuyama. This graph shows the traction that our mobile vaccination program is making throughout the county. This past week saw our largest increase in the past 2 months, with a total of 294 vaccines at 5 clinics, 2 schools in Goleta, 1 school in Orchid, 1 supermarket in Santa Maria, and an ag site in Santa Maria. So we are seeing successes with the smaller vaccination opportunities in various neighborhoods and in various communities. Current outbreaks. We are reporting 36 active outbreaks, 5 among businesses, 19 among schools, and 12 in congregate living facilities. I'd like to share with your board our analysis of cases among 0 to 18-year-olds. The case data was analyzed for this age group who reside in Santa Barbara County. In the 18 months, starting with March 14th, 2020 to September 23rd, 2021, we are reporting 5,893 COVID cases among the 0 to 18 age group. As you can see from this graph that captures the cases throughout the 18 months, the cases by episode date follow very similar trend as we saw in other age group, with peak cases during the winter months. The summer peak of 2021 was higher than the summer peak of 2020 among 0 to 18-year-olds. And interestingly enough, for the same time frame, we saw currently in this in this current surge, a high of 43, somewhere around September. Comparatively, a year earlier, it was only 11. With regards to gender, it's pretty even with 2,951 cases in males and 2,924 cases among females. So pretty much an even split between males and females. With regards to race and ethnicity, we are reporting 3,783 cases in the Hispanic, Latino children, 841 in whites, 682 were missing, 333 were unknown, 80 from the Asian American community, 7 from the multiple races, 48 categorized as other, 7 in the American Indian Alaska Native, and 7 in the Native Hawaiian or Pacific Islander. It's noteworthy to point out that children in Santa Barbara County are more likely to be Hispanic and Latino. This graph describes the 0 to 18 cases by region, and the top 3 are from the city of Santa Maria with 2,012 cases, followed by Santa Barbara at 1,034 cases, and lastly, City of Lompoc at 792 cases. So in summary, the 0 to 18-year-old cases by episode date followed very similar trends to the pandemic, with peak of cases during the winter months. The summer peak of 2021 was higher than the summer peak of 2020 among this age group. And the majority of this age group were Hispanic and Latino. However, as I pointed out, most children in Santa Barbara County are Hispanic and Latino. Most 0 to 18-year-old cases reside in Santa Maria, followed by the Santa Barbara and then Lompoc. I'd like to, before I share with your board our health officer order for indoor masking, I'd like to just share with your board our multiple layers of protection and the thinking around that. So this is the Swiss cheese model, and it shows us key to any good prevention strategy is layering. So while there are holes in slices of the Swiss cheese, by combining the slices, we get a layered approach that leads to fewer holes. This is true for the COVID-19 prevention strategies. The strongest protection comes from getting vaccinated. Protection comes from wearing a mask, physical distancing, washing hands often, and having good ventilation in indoor spaces. Each of these are important ways to reduce risk of getting COVID-19, but become really highly effective when one combines them. To go a step further from this model, we've added the misinformation mouse. It's a cute little icon, but it drives home a very serious point. Misinformation is endlessly harming to the widespread adoption of the layered prevention strategies. Just as this mouse eats away at the cheese, so too does misinformation erode the confidence of the public in proven prevention methods, such as masking and, of course, vaccination. Misinformation mouse is working constantly to break down our Swiss cheese prevention layers. The only way to prevent it is to stick with the facts offered by established, reliable sources of information, such as the CDC, CDPH, and additionally, our local public health sbc.org site. So as a reminder, when heading out to work, to the store, when around others, remember to safeguard yourself and your loved ones and your community with multiple layers of protection, such as vaccination, practicing physical distance, wearing a mask, washing hands often, and ensure good ventilation in indoor spaces. So with that, as I mentioned, wearing masks indoors is a layered approach that will safeguard our community. We first issued our local health officer order 2021 10.5 in August 6. And it is because since the lifting of restrictions on June 15th, the average daily incident case of COVID-19 in our county started climbing and climbing and climbing, reaching the category of high transmission level based on CDC's standards. Significantly, also was a Delta variant circulating at that time in the US as well as in our community. So to control the spread of COVID-19, this health officer order was issued requiring all individuals in the county of Santa Barbara, whether vaccinated or unvaccinated, to wear a face covering at all times in all indoor public settings and businesses with very limited exemptions. So we are encouraged that let me go back. Oops. I am needing to. So we are encouraged, as you can see, the trend is downward. And so we are very encouraged by that. And so what that means is that we have renewed the Santa Barbara County Health Officer Order for indoor masking until we've renewed it today, and it will be in effect until November 5th. The health officer order will be lifted when case rate is less than 6 per 100,000 for 2 weeks. However, masks, we want to remind the public that masks would still be required in certain settings per state health officer order and per Cal OSHA guidelines. So these would be the schools, the healthcare settings, as well as congregate living centers. The triggers that will cause a reissuance after we lift it would be us experiencing another high surge of high case rate over 2 weeks, and concerning circulating variants, as well as dipping hospital capacity. As we mentioned earlier, and great appreciation to your board for allowing us to kick off the flu season. As I mentioned earlier, walk-in clinic or by appointments, community members can go to myturn.ca.gov to see where they can drop by and get a shot or by appointment. And it is the best option to preventing the flu. I'd like to end with great appreciation and gratitude to your board for your unwavering support of public health and our community partners in all of our attempts throughout these past 18 months. In particular, I also would like to thank our various community partners for their support when we go out into the community to vaccinate. And I do believe that because of our community partners linking arms to get everyone vaccinated, we are seeing traction and we are seeing increases in hard-to-reach communities in our county. Thank you. And with that, I don't know if your board would like to entertain questions or I should pass it over to Mr. Champion.
Any questions from the board? Supervisor Williams.
I guess it's not exactly a question. So things in terms of the leading indicators are looking a little bit better. I'm sure our numbers for Saturday and Sunday weren't quite as good as Monday. That's typically the way it goes. But it's still, we're still have cases, and we still have deaths, even among younger individuals. And I think, some people are already asking about the mask thing, and I'm sure that's why you addressed it today. But I think, generally the collective philosophy of this board, I would have characterized as, we would like the less invasive solutions to prevent the greater problems. And so masking seems about the least invasive thing we can do when people's jobs, lives, and and businesses are at stake. So I think we still want to treat the whole matter with a great deal of caution and appreciate that that's the attitude of public health.
All right, any other questions from the board? I have a couple. Slide 18, can you bring that back up for a moment? So, just so I understand that, is it left to right on the effectiveness, or could those be in any order? Or I didn't know if it was any purpose in particular.
They're not in any order, so it was
Okay.
just a demonstration of each strategy layered on top.
I understand, I just wanted to clarify for my own purposes. I know we mentioned when we went into the mask mandate was in part because we were at the high transmittability status according to CDC. Are we still in that? According to CDC? I know they have they don't have the color scheme like we have in California, but according to, are we still in that status within the CDC? Or what is our current status?
We are in the high transmissibility status still because we have more than 7 cases per 100,000 residents.
And I guess that was my other question, was where did the 6 out of the 100,000 come from as a number? Is that arbitrary, or are you guys taking that from something in particular? I think it'd be helpful.
It's a middle ground. The CDC has the cutoff at 7, and the old blueprint was somewhere 4. So we were picking a middle ground.
All right, and then as far as the 18-year-olds were concerned, the 0 to 18-year-old study that you guys did, were you able to compare the percentage per population versus the general population? Are 0 to 18-year-olds getting COVID at the same rate as the general population or less?
No, we didn't look at that, but we certainly can do a comparative at the next board meeting.
All right, and just for the public, this is going to be one of our latter, or at least for now, going to be our last departmental presentation. This will still be on the agenda as an administrative agenda item, but I would love to see that as well. And along with that, maybe looking at hospitalizations and deaths among 0 to 18-year-old comparatively to the general population. I think it's good to have that layer of context for those that are concerned. It is definitely serious, but it's a relative seriousness that I think that probably is better explained when we have those numbers.
Yes, so just the process of us getting data, we scrub the data that comes from CDPH is fairly messy, and so our team writes codes to extract the information. And then on top of that, we were going to include hospitalization data, but in looking at the hospitalization data, there were discrepancies between what our hospitals were reporting and what the state was reporting. So we didn't include it this time, but we will come back to your board with a more comprehensive comparison between the 0 to 18 as well as the general population.
Thank you, Dr. Dordos, Dr. Henning. All right, Supervisor Hart.
Yeah, I just want to say what a great graphic this is. I think this really tells the story well. We had a couple of people speaking at public comment, talking about isolated strategies and, what's the effectiveness of this versus that and in what context. And I think this helps at that 40,000-foot level to really explain the need for thinking in terms of layers of protection. And that's, there's no silver bullet to solving any complex problem, let alone, something like this. But I think this really helps the public to understand that, by putting different strategies in place together and being smart about it, we can really reduce the risk of transmission of the virus. And that's the point, to protect all of us together by doing simple things in tandem with each other to maximize their effectiveness. So thanks for bringing this to the presentation. I appreciate the good work.
Thank you, Supervisor Hart, through the chair. And I have to give great kudos to our comms team for this creation. And this is, throughout this pandemic, we all play a part in the risk mitigation. So Dr. Ansorg, with his clinical background, I lead the department with policy and administration, and then we have our comms team, which take what we do and put it into a graphic form so that we can communicate this to various members of our community. And then there are other community members who likes the data and the graph, and we have our data dashboard to meet that need. So it's really, I'm really being in a very appreciative and thankful space this morning, because as I reflect on this being a last meeting for a while, that it has taken all of us with our strengths and our gifts to be really able to link hands and respond to the pandemic in the way that we have. I think that in comparison with a lot of other colleagues, I have colleagues up and down the state, and we compare notes, and they're jealous because we have a wonderful board, we have a wonderful healthcare system, and we have incredible community partners and we're all linking hands, focus on increasing vaccination and decreasing the case numbers in our county.
Right. Yeah, it's a really good point. I can't miss the opportunity to thank the comms team too. They really are doing a fabulous job every day. You know, Terry, Jackie, Gina, Suzanne, and everybody else that's supporting them. Just even this graphic with the little misinformation mouse, you know, it's so cute. That's perfect. That's exactly part of the challenge that we have, is trying to combat consistent, persistent misinformation. And just, if folks can just go to the publichealthsbc.org website, they know that information is vetted, it's tested, it is reliable, and it's accurate. And that's, you know, you don't have to go any farther, you don't have to search the internet, you don't have to go down a rabbit hole. Just go to that publichealthsbc.org website, and you get the most up-to-date information that's available.
Thank you, Supervisor Hart. I believe this time we'll go to Mr. Chepchin.
Thank you, Chair Nelson and members of the board. I was asked by the CEO to provide an update on the Emergency Rental Assistance Program through the State Treasury. Oh, this is a legal aid slide. Okay. Can you go? Right there, yes. Which one? Okay, good morning again. Let's start all over again. As you can see, there a lot of money has been flowing through the county, through the state and U.S. Treasury for emergency rental assistance program for our residents. There's an allocation of ERAP 1, they were called ERA 1, ERA 2. As you can see, in the ERA 1 round, the county received $13 million, the state received $14 million. In the second round, combined, there will be another $28 million coming to the county residents for emergency rental assistance. This chart summarizes the funding amounts for each of those, ERA 1, ERA 2. United Way has spent our ERAP 1 funds, rental assistance funds, the $13.2 million. And the state has just closed its application for ERA 1 funds due to a projected exhaustion of funds. The state is continuing to process the applications received before its application portal closed. And accordingly, the United Way just began administering the ERA 2 program and is currently accepting applications online. United Way is utilizing county ERA 2 funds as they are received from Treasury. We'll be getting $16 million total. We haven't received all of it yet. And we'll later expand to include the state's ERA 2 funds. So we did have discussions with the state, and they are willing to allow us to expend their funds for the second round. So I think that's really good news for local residents. This slide shows the eligibility requirements for Santa Barbara County residents. Basically, a rent obligation, which is a lease, history of payments, or landlord letter, an income, 80% area media income, and average median income, and below has to be documented. Households can attest to having experienced an economic impact because of or during the COVID-19 pandemic, and that they are at risk of homelessness or housing instability. At the bottom of the slide is the 80% and 50% average medium income charts for household sizes 1 to 4. This slide shows the direct assistance funds from the ERA 1. We do not yet have data for the ERA 2 applications that launched last week. So as soon as we get those, we will update the board on those ERA 2 funds. As you can see, we've served 1,413 applicants. On average, we paid out $8,262 in rent. Over 92% of households were below 50% AMI. 73% of applicants were a family unit. The median household size was 3. And Santa Barbara County residents can apply at the link on the bottom of the screen. Funds are available. There's $16 million coming, so funds are available. Slide 4. Let's see. This is the state program. As you can see, they have, right now, it's almost 2,000 applications, so that number is a little dated, but it's almost 2,000 applications. They spent $4.19 million of the 14 million that they have. So they are going to hold on to this program. They're going to process these applications, and we'll take the second round of the ERA. So they're still processing applications at this point. This slide 5, since SB 91 was passed, the state and our county program have both been paying 100% of rent arrears, current and 3-month prospective rent, and that remains the same with United Way's now live program for the ERA 2 funds. So new with the ERA 2 round of funding is the availability of relocation assistance. Landlords should be aware that ERA assistance can pay for a tenant's moving to a new unit with security deposit, first and last month's rent. So that's. And finally, slide 6, United Way and State HCD are staffing call centers where applicants, tenants, landlords, or courts at their option can check the status of an application. Tenants or landlords that need to confirm the status of an application submitted to United Way should call this number down here, 805-965-8591. Tenants or landlords that need to confirm the status of an application to the state HC, Housing Community Development, should call 833-430-2122. And that concludes the update on the ERA funds.
Okay, any questions for Mr. Chapchin before we go to our next presentation? I have a question. So this program takes an affirmative action from both the tenant and the landlord, or to be eligible for the rental reimbursement?
Yeah, I think it reimburses the landlord at most cases. So they're directly working with landlords to pay the rent.
Okay.
If that's what you were asking.
Yeah, I guess my question goes with, there's a tenant who, their landlord hasn't taken advantage of this program.
The tenant can apply.
The tenant can apply on behalf of their landlord.
Yes.
So those both options are available. So
Yes.
okay. All right. Thank you. All right, Supervisor Hart.
Yeah, I just want to thank Mr. Chapchin for that presentation. I want to thank United Way for all the great work that they're doing in partnership with the County of Santa Barbara. They are really a trusted messenger, an organization that's there, ready to help in a crisis. And the good relationship that we have with United Way, predating the COVID-19 pandemic and their assistance in providing support for renters is a really important resource and an asset for the County of Santa Barbara. And I just want to encourage us to stay close. That is really, I think, if there's anything at all, that there's a silver lining to the pandemic, it is the new tested relationships that we have with the governmental the nonprofit organizations in the community that do direct services to local residents. And United Way is right at the top of that list. And the Legal Aid Foundation of Santa Barbara County is also right at the top of that list. So I asked Jennifer Smith to join us today to give a little bit of information about what it is that Legal Aid is doing to help protect renters in this very difficult environment, with the statewide eviction ban ending on this past September 30th. The information that Jennifer is going to share with us today is even more important. The Legal Aid Foundation is a really important resource to tenants and landlords both, because there's a collaborative relationship there. They're able to help folks navigate this complex space and provide assistance to both landlords and tenants in a way that works best for everybody. So with that brief introduction about what we're going to hear, I really want to thank Jennifer, the Executive Director of Legal Aid, for joining us today. Thank you for coming.
There we go. Thank you very much. Good morning. My name is Jennifer Smith. I'm the Executive Director of the Legal Aid Foundation of Santa Barbara County. Thank you for having me today. And just a reminder that this presentation is for general information only. It's not considered legal advice. Anybody, whether you're a landlord or tenant facing any legal questions, is strongly encouraged to seek their own legal advice about their own specific situation. So just a reminder about who we are. We are a nonprofit law firm, and our mission is to provide high-quality civil legal services to low-income and other vulnerable residents in order to ensure equal access to justice. So, in a nutshell, right, if you're charged with a crime, you're guaranteed the right to an attorney. But in the civil world, you can be facing eviction and you're not guaranteed the right to an attorney. So we do our best to try to meet that legal gap. And our offices are in Santa Barbara, Lompoc, and Santa Maria. Just a general reminder about various different things we do, just as a reminder, but today we're focusing on housing and evictions. So it's important to remember that eviction is a court process, and this is actually something that's often misunderstood. In order for somebody to be legally evicted, there has to be a court order. So just because a landlord says to somebody, hey, you need to get out of here, you need to move, that's not a legal eviction. So in order for an eviction to take place legally, there has to be that court order. And there's a general process that unfolds. So in this context, in terms of talking about payment of rent, the first step that typically happens is an eviction notice that a person will receive. That notice is called a notice to pay rent or quit. Through the end of September, that was a 15-day notice. Moving forward, for rent owed moving forward, it's a 3-day notice. But that puts the tenant on alert that rent is owed. And the next step is the actual eviction lawsuit. So then the parties go to court, and then a judge decides, whether or not an eviction takes place. We're very lucky in Santa Barbara County that before the judge makes an order, we require a settlement process and discussion to take place between the parties. So as much as possible, we hope that the dispute can be resolved before going to trial, but if necessary, the matter does go to trial. There's a court order, and then the final step is the actual physical eviction. So that's enforced by the sheriff's office. They enforce the court's order. They go out. They also issue a final notice and enforce the court's order. So in terms of where we are now, it's important to highlight what protections we previously had in place in order to understand where we are now. So through the end of September, there was a protection in place for people who owed rent. And so if they owed rent from March 1st, 2020 forward, they could submit a declaration to a landlord, a declaration stating that they have experienced some version of COVID-19 financial distress. And so during this time period, if the tenant returned that declaration in a timely way, various protections kicked in. So for the period for rent that was owed between March and August of last year, if the tenant submitted the declaration, they could never be evicted for failing to pay that rent. So they could still be subject to a debt collection lawsuit for that rent, but they couldn't be physically evicted for that time period. And then for the period of September 2020 through September 30th of this year, if the tenant submitted that declaration, they couldn't be evicted. And then if the tenant paid 25% of rent owed during that year-long period, again, they could never be evicted for failure to pay the remainder of the rent. Again, they could be subject to a collections lawsuit, but not physically evicted. And so where we are now, as of October 1st, the state's eviction moratorium has come to an end. So this process of submitting a declaration of distress has ended. And so if a tenant didn't pay that 25% of rent due for the last year, it's possible that they could be evicted now for failure to pay rent, and or if they owe rent moving forward, those normal processes go back into place. And again, most of the normal, pre-COVID eviction laws are back in effect. However, there is sort of this transition period where there's still actually some procedural protections at play. And that runs from October through March of next year. And basically, it's a temporary court process. And so the key components are that we are returning to this 3-day notice to pay rent or quit moving forward. But in order for a landlord to proceed with that eviction lawsuit, they need to demonstrate that they've cooperated and sought rental assistance before that lawsuit is allowed to proceed. And so this modified court procedure applies if the landlord is filing the lawsuit based on a tenant's failure to pay rent anytime from March of last year all the way through the end of March 2022, and the tenancy was already established as of October 1st. So basically what this really means and really emphasizes is that rental assistance remains absolutely critical. It's still available today. And, I think the state legislature really made an effort to say, look, we have been through a global pandemic. We want this rental assistance to get out. We don't want people to be penalized because this global pandemic happened. We really want to guide everybody to apply for and seek that rental assistance. And just some acknowledgements in terms of the various entities who helped me with these slides. And I welcome any questions, if any.
Thank you, Ms. Smith. Supervisor Hart.
Well, I just want to thank Ms. Smith for that great presentation. It really helps explain how the interrelationship at the end of the statewide eviction moratorium with this new period of time that gets out to March 1st, 2022, and how the rental assistance program that we're still using and allocating funds through United Way, how those fit together and really do provide a level of protection to tenants that if they can make themselves available or take advantage of these programs can really make things better for them and their families. So thank you for coming today, and thank you for sharing this really important information with the community.
Thank you, Supervisor Hart. Supervisor Williams.
I want to thank you for being here, and that was very cogent. Can you take the opportunity? I know because they're a charter city, Mr. Hart and myself represent the city of Santa Barbara.
Mhm.
They have some additional protections because they're a charter city. Can you give that out in a little bit of information, mainly for the benefit of our staffs who are right now dealing with a number of tenant issues and trying to lead them through the process?
Yes. So broadly, the city of Santa Barbara does have some additional. Generally speaking, most eviction law is governed by the state of California, and then local jurisdictions can be more protective or provide additional rules and regulations in that arena. And in our community, city of Santa Barbara has several of those. So there is. And I can also respond with more of the details, but in general, there is a relocation assistance that's required in the eviction context. There is protections also for requiring a reconciliation or mediation process before the eviction lawsuit proceeds. And there's also some rules about leasing agreements and written leasing agreements. So there's a couple of added layers of protection for City of Santa Barbara residents. I think with an eye towards what this pandemic has really demonstrated is just how dangerous housing instability can be. And so I think the city's protections are trying to tackle and address additionally those instability issues. And I can follow up with further details on all of those, but in general.
Thank you.
Yeah.
Thank you, Supervisor Williams. Supervisor Hart?
Oh, I'm sorry, I just had my mic.
All right. I had a few questions for you, Ms.
Yes.
Smith. So what would make a tenant or landlord ineligible for rental assistance?
If the family income were above the 80% AMI, they may not, it's possible that, they wouldn't be eligible. There's also just, right, there's an incredible amount of dollars available, but as we saw in that round one, the funds may end up being exhausted at some point. So there's a possibility that there could be more applications than funds allow. So they could be denied just once the program funding runs out. And, the family has to demonstrate a COVID-related hardship. But, that, I think sometimes people are misinformed. They think, oh, I had to have COVID, or like I had to have a family member have COVID, but, it could be that your hours were reduced at work, or, you had a furlough, or
Childcare, yeah.
Childcare, right? So many people had to stay home in terms of the school issues. So those are all things that can qualify you.
Right. Well, actually, let me ask Mr. Chapchian for a minute. So, because there are people being rejected from the program, I imagine, or that are applying. Is income tend to be the leading determination on that?
Chair Nelson, yes, it is. It's 80%. Sometimes it goes down to 50% AMI.
On the program?
Yeah. So it basically is income if they've been impacted by, and it's self-attestation too. If they've been impacted by COVID, they lost a job or reduced hours, as she was alluding to.
Is the income portion a self-attestation as well? Or is it just the hardship portion?
I have to double check on that. I think they have to, I think that's not just self-attestation. I think they've got to prove that.
All right.
Yeah.
And then a couple other quick questions for Ms. Smith. So if somebody's paid 25% and now it's October 1st, is there a landlord allowed to require them to pay arrears first before they start paying their October rent? Or is it a new line moving forward? Or is that unclear?
Yeah, it's, it gets a little, it gets a little complicated in terms of how that applies. But if they have paid that 25%, they can't be evicted. So typically, if you've covered yourself and you can pay your rent moving forward, that tenant will be protected.
All right, thank you. And I guess my last piece is just a comment is that, I've seen over and over throughout the pandemic, landlords and tenants working together.
Yeah.
And I would encourage anybody in the public who's in hardship, if you haven't had the conversation with your landlord, have it. If there's a landlord who suspects that a tenant's having a hard time, have that conversation. I think we can do a lot more through dispute resolution than the legal process if necessary. So I want to make sure that is said moving forward here on this. So thank you, Ms. Smith. I believe we still have public comment on department item number 1, but Supervisor Williams?
Well, I just wanted to also, I asked Dr. Ansorg a question that we all got emailed this morning about drinking water fountains. And so after public comment, I just wanted to make sure he let us know the answer publicly so that people know that what the issue is.
All right, thank you, Supervisor Williams. So this time we'll go ahead and go to public comment. Madam Clerk.
Thank you, Chair Nelson and members of the board. We have 9 requests to speak under this item today. And I would just like to remind members of the public who did register to speak on this item under Zoom to please log in now. We will go to our first speaker, Monique Verdon, to be followed by Danny Blanc.
Okay, before we go to Ms. Verdon, I'm going to go ahead and close public comment on this item. Ms. Verdon, when you're ready.
Hi, let's see if I chose that, that's fine. So I just want to share, I first of all want to thank Supervisors Nelson and Lavagnino for all that they do to support freedom and our constitutional rights. I want to say I was born and raised in Santa Maria, as was my dad, and I am currently raising my children here. I am a teacher, my husband is a firefighter, and we are both at risk of losing our jobs because we believe in the right to bodily autonomy. We believe in the inalienable rights we have in our Declaration of Independence of life, liberty, and the pursuit of happiness. And we really feel that if we don't have the right to say no to what is done to our own bodies, as was mentioned earlier, I really heard the people speak about the importance of freedom and in the medical realm of the right to abortion. Well, I believe we also should have the right to decide what is injected into our body. And without that, I really wonder, what do we even have freedom if we cannot say no without threat of losing our jobs, without, to support our children and our families, or having to flee a state that I love. And I really just want to share that. I was involved in SB 277 for children in 2015 to stand up for their rights to medical freedom, for their right to attend schools. And my children lost their right to attend school at that time. I went up to the Capitol several times, and I knew at that time the power of the pharmaceutical industry, that they would not stop with the children, that if we didn't stop them then and protect our children, that they would come for us adults. We knew that. There was healthypeople2020.gov already said that vaccination would be tied to employment. Here we are in 2020 in February. I realized, oh dear, it's 2020. And I remembered that healthypeople2020.gov that I found out about in 2015. The pharmaceutical companies own our media. And I hear people during this time today say, we need to listen to the CDC. We need to listen to the mainstream media, what they're saying. Those entities are bought and paid for by the pharmaceutical companies. Where do you think the revenue comes from? All the ads on TV. Do you think that they're going to say anything otherwise and lose that revenue? We really need to question what is happening in the world and not just listen to what the mainstream media is. History requires us to ask questions and not just do what we're told. So I just wanted to share that a little bit, and also just that these vaccines, when they said that they were approved.
Thank you, Ms. Verdon. That is your time.
We will now go to Danny Blanc to be followed by Dr. Amy Smith.
Hi, thank you for letting me speak. It was very interesting to hear that the data is a little messy. That was very interesting hearing that. And I would like to request 2 simple things since you are mandating masks and vaccine. One is, how about you show us the science that when we are entering in a restaurant with a mask, COVID, we can get COVID. And when we sit at the table, we cannot get COVID. So I would like to see the science on that, because I don't know, it doesn't make a lot of sense to me. And the second, since you're mandating the vaccine, how about you also show us the ingredients in the vaccine? I think we have the right to know what exactly is going into our bodies. And now I would like to read something that I find very interesting. We remember your names. When a healthy young mother forced to get a vaccine, she neither wants nor needs to attend these child schools, drops dead. We remember your names. When a child's heart is permanently damaged so that they can attend summer camp we'll remember your names. When a father can no longer walk with his son, we'll remember your names. You sit on boards, you lead cities, you create policy, you draft documents, your names will be remembered. And one day, when the sleeping people who trusted your authority are shaking awake by their own personal loss, your names will be the ones they remember. Your fate will be decided by those whose lives you so callously ruined. We all remember your names. Thank you.
Thank you.
We will now go to Dr. Amy Smith, to be followed by Justin Shores.
Dr. Smith?
Yes, thanks. I'm just trying to set up a timer. I have many concerns. One is, as you, the board, are the ones supervising and overseeing the health department, it's very important that you understand the difference between a single factor data set and a multi-factor data set. So it's very disturbing that we were told today that masks work because a plot was shown that says when the mask policy came in, that it was helping, but also the Delta variant was coming in. And so, Dr. De La Reynosa did mention that, but you cannot then make a conclusion. That's why you do studies independently with an independent variable and you have a control group. That's why before you mandate a vaccine, so-called, that is really a brand new genetic engineering technology that has never been proliferated widely into the public before, you do the controlled long-term studies and at least finish the trials, which are not due to be finished until the end of 2022. So that means you're coercing people into an experimental product that claims to be FDA licensed. Unfortunately, that product that received license is not available anywhere in the US at this time, and we don't know when the Comirnaty vaccine will be. The only thing you'll be available to get to satisfy the requirements of this coercive vaccine mandate is the one that is still emergency use authorization and fully liability shielded. So it is very, for the same reason, it's very disturbing when Dr. Ansor claims that there's a epidemic of the unvaccinated, when again, we have many factors going on at the same time. He puts up plots of the county data, but does not say what's happening with the people who are partially vaccinated. Are the partially vaccinated are being lumped in with the unvaccinated? What if their immune system is somehow being affected so that they have a higher chance of getting a positive PCR test, whatever that might mean? Same with the hospitalization data. We were shown that 85% were called unvaccinated and 15% were called fully vaccinated. Where did the partially vaccinated category go? That went in with the unvaccinated. So that is not good science. That is not honest then to make these kind of determinations from this kind of messy data, and people should be more careful. And you as the supervisors need to be aware of this, and I'm happy to talk to you anytime and go over this carefully, detail by detail, at your leisure. I'd also like to point out there are many slices of cheese missing. First of all, there might be some mold on the piece of cheese that represented masking, because when people collect bacteria and other dirt and contaminants in their mask, like little children flopping them around, that can be very dangerous, and that risk needs to be considered. Other slices of cheese might have been vitamin D status, might have been ivermectin or monoclonal antibody treatment, and it might have been getting weight down and eating a very healthy diet, avoiding sugar, alcohol, and illicit drugs. Those all are great. Thank you.
Thank you, Ms. Dr. Smith.
We will now go to Justin Shores, to be followed by Maria Kastner.
Mr. Shores?
Thank you. Thank you so much. I definitely echo what Amy was just saying on the cheese smelling a little rotten. But it seems like there's no credibility there with no layer of natural immunity, which is shown to provide up to 12 months of protection. So you guys need to add that in there and start talking about natural immunities. Also, that should be considered before mandates. I mean, are we looking at how many kids have been exposed to this virus by now? I think at this point, we all have been exposed in some way, and our bodies have either processed it or rejected it, or we've gotten sick, and at different levels. So being let's be more realistic about all this stuff. Also, let's be accurate. You want us to listen to your data, but then you're not accurate. You give us incorrect stuff. So it's really hard for us when you have no credibility to just trust you, Mr. Hart. You want us to go right to your website, but there are differing websites. There's different opinions out there that are credible, very credible, way more credible than you, based on all of the lies and misinformation and the lack of information you guys have. We've been asking for a lot of information from the health department. They aren't giving us anything. How are you coming up with all this stuff? Is it just coming from the party? That's what it seems like. It seems like it's coming from the federal government. You guys are doing what you say, doing what they say, with no end in sight. I think the only thing that the CDA or that our health department has is on their radar is vaccines. That's your only way through this. But it looks like right now we're ended up meeting in the middle with unvaccinated and vaccinated people actually being affected about the same. So I just ask for honesty. You realize a lot of people are losing their jobs. We also have a big section of minority that is affected by this more than anyone else. Those are the people at my work that are confused and are asking the questions. They don't want this shot. They don't want you to force it to them. So you guys are racist. You guys are going after the lower, the people that have deep convictions on this, and you're calling them, you're saying that they're liars, you're saying they're misinformed, but they have a deep conviction against this. And look at the demographics. White people, I think, are 70 to 80% vaccinated. Latinos in the 30 to 40%. And we're also seeing their numbers the highest. So if you're taking this out on the whole community without seeing all the little pictures, why are these people hesitant? They're hesitant because they don't trust the government. And you guys haven't helped us. You haven't proven your case ever. I think this is really a point of time where you guys have to decide whether you're going to keep going on with the lies or you're going to stop, look at all the data, look at the data from California. There's a lot of studies right now on masks and vaccines in California that you're ignoring because you're going to one source. Supervisor Hart, you have one source. That's not a good idea. You should open your mind, get more sources. So it's going to help you feel better about your choices in the future as you see all the consequences come around.
Thank you, Mr. Shore. That's your time.
We will now go to Maria Kastner, to be followed by Zoe Guess.
Ms. Kastner, when you're ready.
Good morning, Board of Supervisors. Again, can you hear me?
We can.
Okay, I also would like to reiterate that that we have submitted plentiful California public records requests, and that as per your own health professionals, county health professionals, your messy data, which we requested, has not been given to us. And there is a legal process for this. And so we would like to pursue to get our hands on this messy data so we can look at this messy data for ourselves for some of the following reasons. Clinicaltrials.gov, clinical trials administering millions of vaccines still does not equate long-term studies. Those millions and millions of people being inoculated with COVID vaccines does not equate any long-term study. It's just in volume. And anybody that thinks that just the number of COVID vaccinations equates a long-term study needs to go back to the basics of science. Secondly, when the FDA licensed the Comirnaty vaccine, they're missing ingredients. I go directly to the FDA website. I can't find anything with those, those open spaces on the Comirnaty insert package. I have the FDA letter from August 23rd that I printed off the internet. It has been scrapped off the internet. On footnote 8, it says the licensed vaccine has the same formulation as the EUA authorized vaccine, and the products can be used interchangeably to provide the vaccination series without presenting any safety or effectiveness concerns. The products are legally distinct with certain differences that do not impact safety or effectiveness. Well, why not fully license the BioNTech Pfizer vaccine, which still has EUA status? When I check on the internet for availability for Comirnaty, there is no Comirnaty available in Santa Barbara County. So that's another issue. Also, I'd like to reiterate that Jacobson versus Massachusetts, the court did not extend the rule beyond the facts of the case. Before Jacobson was fined $5. Harlan, which is one of the judges, the Supreme Court judges, ended his opinion by stating the limitations of the ruling. We are not inclined to hold that the statute establishes the absolute rule that an adult must be vaccinated. If it is apparent or can be shown with reasonable certainty that he is not at the time a fit subject of vaccination, or that vaccination by reason of this then condition would seriously impair his health.
Thank you.
We will now go to Zoe Guess, to be followed by CC Parsons.
Welcome, Ms. Guess.
Hi, thank you so much. Thank you all for taking the time to listen to your community. Das, you helped my dad find a new home when the city had to demolish his old one. And Chair Nelson, you truly listen to us and you ask important questions where others wouldn't challenge the narrative. Supervisor Hartman, you have a young grandchild and speak of them with endearment. And Supervisor Hart, well, you have Hart in your name. What I'm getting at is that it seems that the majority of you have a heart and that you truly care about your community. I'm going to invite that heart to listen now, to open up, and to hear what your brothers and sisters have to say. I'm going to invite your higher selves to connect to God, the universe, your angels, and all of your ancestors now. There has been a government overreach. It is not about a virus at all. It is about gaining power and control over all of humanity. And now the children. Article 9 of the California Constitution states that children are guaranteed in-person learning without vaccine coercion. Hartman, you speak so passionately upon abortion rights. Why are you dismissing our right to choose what we inject into our body? This has gone way too far. I implore you to stop the mandates now and send a message to our governor that never, ever, ever will this word, his word, be superior to the parents over their children. The arrogance and self-righteousness must end now. God bless you all and your conscience. Thank you so much.
Thank you, Ms. Guess.
We will now go to CC Parsons in Santa Barbara, who will be our final speaker.
Oh my goodness, that was my friend Zoe. And Das, I went to school with you. I grew up here. I love this city. I love this town. I don't even know what's happening in this room. When I watched this morning, you guys giving each other shots in a room like this, when there are massive things going on and wrong. It was this disconnect as to what is happening in our world right now. So I'm just going to speak to the subject that's being the topic. I have a friend who has HIV. He has full-blown HIV. He's had COVID twice and lived. My sister had COVID twice and didn't even know it. I don't understand how this has gotten where it's gotten. I don't understand why my friends are getting fired for not getting the vaccine. They're being forced into it. There are lotteries giving away these vaccines. There are coercions in every form. Concert tickets, like insanity. Cruise tickets to get a vaccine. Like, we are living in a dystopian reality right now. And if you don't understand that, then something is very, very wrong. When we give away the sovereignty of our body and our choices to not have something injected into our veins, not only was the Patriot Act successful then, the next level and the next echelon of our civil liberties and rights being taken away is here. It's happening now. And if you guys don't care about that, and if you don't see it and want to stand up for your rights as well as the people that you are representing, there is no hope. I will not get this vaccine. I am going through my savings. I own my home, thank God, but I will not get it. I watched my mom begin to sweat profusely from the vaccine. I've watched other friends have horrible, horrible side effects from getting the vaccine, whereas I, in perfect health, I won't bring that on myself, and I wouldn't imagine that you would ever ask anyone else to do the same. I believe in my immune system. I believe in not injecting illegal drugs into my veins, which is exactly what this is. And I ask you to remove yourselves from this position of whatever's happening here, of these mandates with this governor who's asking us to trust him over the parents of these children who make good decisions, and they're responsible for their kids, not a governor somewhere else. This is our city of Santa Barbara. It's always been open-minded and free-thinking and loving with each other from the time I was a child. And I hate to see this bureaucracy coming down the way that it is. It's truly heartbreaking. So please, let's do something. Thank you. Thank you very much.
Thank you, Ms. Parsons. Okay, back to the board for any additional questions and comments. Supervisor Hartman, then Supervisor Williams.
Yes, I have an interesting comment, something that I ran across Library of Congress. During the Revolutionary War, about 90% of the deaths in the U.S. Army were not from combat, but from disease, and most specifically smallpox. So as a result, General Washington wrote a letter, February 6, 1776, stating, quote, "Finding the smallpox to be spreading much, and fearing that no precaution can prevent it from running through the whole of our army, I have determined that the troops shall be inoculated." And he explained this because we have more to dread from this disease than from the sword of the enemy. And at the time, vaccines weren't very sophisticated. They rubbed a piece of cloth over a less virulent version, cut open the skin, and then rubbed that in. But what they found after doing this is that afterwards, it was so successful that although they had little outbreaks, it didn't incapacitate a single regiment. So vaccine requirements go back to the Revolutionary War, the War for Independence.
Thank you, Supervisor Hartman. Supervisor Williams.
Well, I appreciate the passions and the opinions stated today. I just want to address more than anything the motivations of my colleagues and defend those motivations, especially when they're named by name. You know, my conscience does dictate that I look at counterfactuals and look at the situations and the possibilities if we are wrong. But it also dictates that something must be done when, if you look at those statistics that the staff just put on the screen, one in 10 people in this county have got COVID. I suppose that number could be thrown off a little bit for numbers of people who got it twice. And that 1 in 90 have died from it, right? You know, that's a lot, right? And so I just think that that is a dictate to my conscience to take precautions. And our immune system is something I believe a lot in. I'm definitely one of those parents that believes in my kids getting in the dirt. But our immune systems have proven insufficient for polio, insufficient for Spanish flu, insufficient, as Supervisor Hartman indicated, for smallpox. And we have repeatedly, as a society, been successful against these pandemics with vaccination as a strategy. So I am supportive of efforts to question and have rigorous testing about vaccines, and I'm sure there will be improvement in it. But I definitely feel that the weight of emergency is still foremost in the pandemic. The loss of life from that, the danger posed by it, and that we should treat that, continue to treat that seriously. Yeah.
Thank you, Supervisor Williams. Supervisor Hart?
You know, I think one of the speakers in public comment referred to a Public Record Act request, and I think Dr. De Reynoso wanted to respond to that.
Dr. De Reynoso?
Yes, so we do get quite a few requests for information through PRA, and I want to assure your board that we are very compliant. We do respond within the allotted 10 days. However, there are many requests looking for information that we simply don't have. We don't have access to FDA clinical trials. We don't have access to many things that they are looking for. So we state it as such. And then there are requests for detailed HIPAA type of information, and we cannot release those either. So we are very professional and in our response, and we do meet the stated deadlines. And I wanted to reassure your board that the Public Health Department is compliant. And whenever we have worries or we don't know how to respond, we do reach out to our county council and respond with under their guidance.
Thank you. And I have a couple quick questions for Dr. Anzorg, if you don't mind. Thank you, Dr. Anzorg. There's been some questions about natural immunity. And would you mind speaking to that for a moment? Because I know that's something that's kind of becoming a hot button issue, you know, natural immunity versus the vaccine, and whether that's potentially an adequate replacement. So if you could speak to that, that'd be helpful.
Of course, Chair Nelson and members of the board, it is, of course, you know, on many people's mind is how potent is the natural immunity after having recovered from a virus infection. The science is unfortunately very controversial. The results differ widely. So honestly, the jury isn't out. There are studies that show that younger people in particular may have a more robust immunity, but we do not know for how long this level of immunity lasts. Some studies have shown that people over 65 in particular lose their immunity much faster or don't even mount an immunity even if they recover from the virus infection. So unfortunately, I'm asking CDPH every week about more data on this, and I can assure you that it's being looked at, but the data is simply not consistent, and therefore we are not comfortable reassuring people that they're completely safe when they have recovered from COVID, because we don't feel comfortable stating that, because we would put them at risk if we were incorrect, and therefore we will have to wait for more conclusive evidence.
Okay, so I'm hearing that it varies based on age and other factors, and it's not a one size fits all when it comes to natural immunity.
Yeah, it definitely is not one size fits all. Sure. That is so true.
All right, and we've been talking about misinformation a little bit earlier, and so I wanted to kind of clarify something that I think that might be misinformation in the community, that that just because you're vaccinated that you can't get COVID and you can't spread COVID. It seems to be. I've had lots of conversations with a lot of people that are amazed when somebody who's vaccinated gets COVID, because there's a perception out there that doesn't happen. I know you're less likely, but that's still possible, and there's still community spread. among the vaccinated. Is that correct?
Well, I would have to answer that a little more nuanced than
please.
just yes or no. So the vast majority of all transmissions is from unvaccinated folks to unvaccinated folks, more than 80%. So that has to be, put in context. More than 98% in this country of people who die from COVID in the hospitals are unvaccinated. So the majority of people who are in the hospital with severe COVID, sometimes fighting for their lives and recovering eventually, are unvaccinated. So there is just no question that the vaccination is incredibly helpful.
And I don't disagree.
Yeah.
As I've said publicly, I'm vaccinated. I advocate for people to get vaccinated on a personal level and making that personal choice.
So I just feel that I have to set the stage for
Sure.
my answer
No.
a little bit. So we have to put it in perspective. And yes, there are infections in people who had the vaccine. Most of these people are elderly. And we do know that an elderly immune system is not as strong in mounting any kind of antibody response to a vaccine or a disease. So if an 85-year-old gets the COVID shot, they may not be as protected as somebody who is 50 and gets the COVID shot because the immune system does not mount such a robust response. And so it's much easier for somebody like that who doesn't have a good immunity through the vaccine to actually catch COVID again. Yes, it does happen. And it does happen in Santa Barbara County, absolutely. But they do not necessarily spread the virus more because studies have shown that if you had the vaccine and you get COVID, regardless, you carry it for a much shorter period of time. And so you do not spread it as much.
But when you're vaccinated, you're more likely to have asymptomatic spread. Is that correct?
No, I don't think that's fair to say.
Okay.
You have likely less severe disease when you're vaccinated, but it doesn't mean that you are completely symptom-free.
But, I mean, that's what occurred in the jail, right? When our vaccinated employees that spread that to
That is correct, but they had mild symptoms.
Right. So I guess the point that I'm trying to make is that, a reason why we know that there's more people that are positive of COVID that are unvaccinated is because they're going to have more symptoms. And so the reason why I'm trying to, I guess, ferret out here is that there's maybe a false sense of security once you're vaccinated, that you won't get it, that you won't spread it, but that's still a challenge in our community. And I think there's a variation potentially in our numbers that we're looking at is you're most likely not going to test yourself for COVID if you're vaccinated because you feel like you have that immunity there and you might potentially spread it. I acknowledge that we're not spreading for as long, but that they're potentially spread without some of the early alarm systems of symptoms that we might have for someone who's unvaccinated. So I just want to make sure that conversation is still being had. I understand that that's inconvenient for some of those that want to just push for a vaccine, go there no matter what. But I do think that is, to try to be, I hope, honest about what exists out there, that it's not a cure-all, that as soon as you get vaccinated, that, that you're out of the woods. Again, practicing some of these other Swiss cheese things like social distancing, good ventilation are still going to be necessary. And so I guess, again, I want to have that conversation, and that's why I was trying to mention that and understand that better.
Yeah, I agree, but I'm not contradicting that at all. I think that's also why we came out with the indoors health officer order for masking for anybody, vaccinated or not. I think we were in the beginning, prior to the advent of the Delta variant, we were maybe a little bit too exuberant about the fantastic protection through the vaccination. And that's when the OSHA requirements and everything was changed, that, people, when they were vaccinated, didn't need to wear a mask and all these kind of things. And then we were proven wrong by a variant that's more transmissible. So that's why, we had to pivot and change the protective measures, as you alluded to the varying methods combined work the best, obviously. But it's still remarkable how well this COVID vaccine protects, for instance, compared to the flu shot that I got earlier this morning, is not as effective, and I know that. So when we compare vaccines, so far the COVID vaccine is a blockbuster, quite frankly. I mean, it performs so well in protecting severe illness and death.
Totally agree.
That is really remarkable. And what we've also seen is that mandates do work. You know, New York City, they had, I don't know what percentage of healthcare workers were unvaccinated. And with the mandate, it came down to like a very small number, maybe 1 or 2%, or up to 3%, who, you know, didn't want to get vaccinated. So mandates do work. Just like when public health recommends something, for instance, we recommended in June to keep wearing a mask, nobody listened. That's also the fact of the matter. We are all human, and if something is only recommended, we don't get as good a compliance as if it's mandated. Unfortunately, extraordinary times or situations require, you know, more stringent or extraordinary measures, and we want to always respect people's liberties, but we have to also do our duty in protecting everybody. And that is what I hold against the anti-vax movement, is that they always say, this is my freedom. Yes, but what about your neighbor who has a weakened immune system? Or what about the rest of the community? So there is, of course, an unalienable right of my own freedom, but there's also a responsibility to the greater good around me. And so we have to strike a balance. And I just want to take this opportunity, because it's also the last time, that, you know, I've been listening to public comment here week after week, and I would really like to state for the record that comments that were shared, even again today, they represent the personal opinions of the public speaker. In no way are they substantiated necessarily by science. That needs to be understood. If somebody repeats a false claim again and again and again, that false claim does not become reality. And I'm concerned, quite frankly, that the constant public repetitions of falsehood and unsubstantiated claims may actually influence or leave the audience insecure or uncertain about actual facts. And that is a concern to me. So repeatedly, the PCR test has been, you know, put in the crosshairs of commenters, not so much today. But the vaccines are always represented as being very, very dangerous. The VAERS reporting and so forth is always stated as showing thousands and thousands of deaths, which is really not factual, because the VAERS is an early warning system that is very crucial in making sure that the vaccines are safe. And every VAERS report gets evaluated by experts, and it does not by in any means mean there's causality between a report into VAERS and the actual side effect. So that, I think, is important to understand. And lastly, the science on the protective effect of mask wearing is absolutely clear. So the spread of an aerosol transmissible disease like COVID and other viruses is really most effectively mitigated by a combination of things: vaccination, social distancing, mask wearing. And I think also in Santa Barbara County, with the measures we have taken, I think we've shown that it has worked. And I just want to thank you for your leadership and listening to our advice from public health and supporting us in keeping our community healthy as possible, and therefore in a better place. Thank you.
Thank you, Dr. Ensor. All right, can I get a motion to receive and file departmental item number 1?
So moved.
Second.
All in favor signify by saying aye.
Aye.
Motion passes unanimously. Okay, for the purposes of agenda management, we'll go ahead and have the item D2, and then we'll be breaking for closed session.
Chair Nelson and members of the board, departmental item number 2 is from the sheriff. It is a hearing to consider recommendations regarding a resolution increasing 11 of the Santa Barbara County Sheriff's Office fees for requests for records information, notary, photo, audio, CDs, video, DVD, carry concealed weapon renewals and amendments, press passes, and the addition of 2 fees, identification cards and cannabis site security plan review fees. And there is a 4/5 vote required for this item.
All right. I believe we have Hope Vasquez available. Ms.
Yes,
Vasquez?
good morning.
Please.
Good morning, Chair Nelson and Supervisors. Let me introduce myself. I am Hope Vasquez, the Chief Financial Officer for the Office of the Sheriff. A lot of work went into this, and I want to recognize all of those who worked on this resolution. I would like to thank Sheriff's Fiscal Officer Bill Colson, Cost Analyst Divine Mallow, and Sergeant Frank Vasquez for all the work on this item. And I would also like to express my appreciation to the Auditor Controller's Office, County Council, and the CEO's Office for all the assistance provided to us in bringing this to the board. Next slide, please. So this morning we have a very short presentation on the request to establish 2 new fees and increase 11 existing fees for the Office of the Sheriff. All of these proposed fees, except those limited by statute, allow for full cost recovery. And of course, the last time we came to you was in 2019 was for our live scan operators. Next slide, please. The 2 new fees are, one is an identification card. This is for the printing and processing of identification cards, and this is just a cost recovery charged in order for us to recoup our costs on this. And the second is a cannabis fee, which was not included in any prior resolution. This fee is to cover staff time reviewing and working with permitting applicants to ensure site security requirements are incorporated into the approved land use permit. This is currently a required review performed by the cannabis compliance team. However, it is not reimbursed at this time. Next slide. As I stated earlier, there are 11 fees that have not been adjusted in many years. The current proposed charge will allow us to recover the costs of the services. All these costs have been reviewed to ensure that we meet the statute, and in some cases, the charge is capped due to code. Next slide, please. So our recommendation today is just to establish the 2 new fees, as well as approving the increase in the 11 that have not been updated since 1989. And these would be going into effect today. Next slide, please. That's all I have for you, and if I'm available for any questions.
Okay, questions from the board? Supervisor Williams?
No question, just very happy that you're putting this forward. It's important that we have the cost recovery in the department necessary to have adequate staffing. And, I hope this answers that need. I guess maybe my question would be, in my queries of personnel, they've said that there's probably more than 1 FTE, maybe just short of 2 FTE equivalent, at a given time doing the permitting stuff. Will this recover that much, or was there just some hours that we couldn't quite nail down and account for? Meaning, is this an adequate to cover that amount of folks?
Supervisor Williams, through the chair. This is an attempt to become adequate. So this is a start. This is just one of the little pieces for the cannabis compliance team that was not picked up in prior resolutions that we're trying to get reimbursement for.
Thank you, Supervisor Williams. A couple quick questions for me. Ms. Vasquez, can you explain the ID card? I'm a little, didn't quite understand that. So is that like, kind of like a California ID card? I mean, what's that work?
So it's a basic general ID card. It can be anything like the card that you wear currently as a county employee. We provide these cards to taxi drivers, for the treasurer tax collector, for other departments. This is just a way for us to recoup the fee of the card, the equipment required to do this, and the time to print these cards for other people.
So we verify people's identities and issue a card so they have some kind of government ID?
Correct. This is done through our live scan when we do our fingerprinting.
Okay, great, thank you. And then I think I have, sorry, bear with me. The cannabis site security plan review, is that a per visit fee or is that a one-time fee reviewing the site?
That is my understanding, and I might be incorrect, and I wish I had Sergeant Vasquez with me. My understanding is that is a permit fee, so it's per permit. However, I do believe that if they have to go back for additional review, they will charge, but I could get somebody, get that information back to you.
I see Mr. Sergeant Vasquez is on the Zoom, so.
Supervisor Chair Nelson, Supervisor of the Board. So kind of a partially correct answer. So essentially, because the required work to get it right the first time is really needed on the initial planning land use permitting component, anything that's done afterwards is really not that intensive and can be finished up or followed up on during the business licensing process.
Okay, so it's intended to be a one-time fee per license?
Yes, sir.
Okay, thank you. And then the last question was on, for Ms. Vasquez, was the CCW permit applications. I see that there's no estimated revenue. Is that because the sheriff doesn't intend on issuing any of those?
Unfortunately, our estimated revenues, we did not increase any of our revenues for these fees, mostly because of legislation that reduced revenues in other aspects. But
all right, thank you. Partly rhetorical. With that, I'd be happy to take a motion. Or sorry, are there any public comments on this item?
Chair Nelson and members of the board, we have no request to speak.
All right, thank you, Madam Clerk. With that, I'll take a motion.
I move recommended actions A and B in the staff report for today.
All right.
Second.
All right, any further discussion? Seeing none, all in favor signify by saying aye. Aye. Motion passes unanimously. All right. Thank you. At this time, we will go ahead and break for closed session. Madam County Counsel, can you please let us know what we're talking about today?
Thank you, Mr. Chair. In closed session today, we have a conference with legal counsel for anticipated litigation, Government Code Section 54956.9, deciding whether to initiate litigation, one case. And we have a conference with labor negotiators, Government Code Section 54957.6, and for all bargaining units, unrepresented employees, managers, and executives. And the time estimate for closed session is 1 hour and 15 minutes.
All right, thank you. So we will be back at approximately 1:15. Welcome back. We are now reconvening the meeting of October 5th, 2021. Madam County Counsel, will you please report out from closed session?
Mr. Chair, members of the board met in closed session on anticipated litigation, deciding whether to initiate litigation, one case, and conference with labor negotiators for all bargaining units, underrepresented employees, managers, and executives, and the board took no reportable action.
Thank you. The next item is departmental item number 3. Madam Clerk, will you please read that item into the record?
Chair Nelson and members of the board, departmental item number 3 is from Community Services. It is a hearing to consider recommendations regarding a library ad hoc committee update and countywide free library system annual agreement.
All right. Mr. Chapchian.
Good afternoon, Chair Nelson and members of the board. It's a pleasure to be here again. Today, we'll be providing an update on the work of the board's appointed Library Ad Hoc Committee and provide recommendations towards the goal of a more efficient and sustainable regional library system. Just a few brief comments. Why are libraries important in this day and age? Public libraries aim to create welcoming and inclusive spaces. They advocate for freedom of inquiry and expression, foster civic participation and economic opportunity, and ensure literacy and lifelong learning. At the heart of these goals is the premise of equity, the shared aspiration that every person might have all they need to succeed. Libraries are the places where you can expect smart and clear answers to even the most difficult questions. Sidney Sheldon, who's an American writer, director, and producer, said it nicely and aptly when he said, "Libraries store the energy that fuels the imagination. They open up windows to the world and inspire us to explore and achieve and contribute to improving our quality of life." And then finally, just a brief quote and advice from Albert Einstein, who said, "The only thing that you absolutely have to know is the location of the library." So I thought that was really good. So with that said, I'd like to turn the presentation over to Ryder Bailey, our Community Services Department's Chief Financial Officer, and Ryder's been instrumental in moving the work of the ad hoc committee forward. Ryder?
Thank you, George, and good afternoon, Chair Nelson and members of the County Board of Supervisors. Before I begin my presentation today, I would like to take a moment to thank all of the Library Ad Hoc Committee members for their support and participation. Supervisors Williams and Hartman, our 4 library directors, Jessica Cadiente, Sarah Blyle, Mary Housel, Allison Gray, as well as our LAC member and Friends representatives, Patricia Saley and Judith Dale. Lastly, I'd like to thank Legacy Works, who have assisted us along the way. Here's today's agenda. I'll start with a very brief overview of our system, then an update of the work of the ad hoc committee, discuss what is next, and end with staff's recommendations. The county annually contracts with 4 cities and their municipal libraries to administer 9 county branches. 4 branches are located in cities and receive both city and county funding. There are 5 county branches located in unincorporated areas and have no other public funding source. The Library Ad Hoc Committee was established in late 2018 in response to repeated one-time funding requests to fill library budget gaps. The purpose of the committee is to outline a path to achieve a sustainable and equitable finance and government system for county libraries. I thanked our members earlier, but here they are again, and the facilitation was provided by legacy work groups. I will briefly summarize the phases to date on this slide and dive in a little bit deeper later in this presentation. In phase 1, we established our purpose, our guiding principles, gathered information, and addressed immediate budget deficits. In phase 2, we collaboratively established library categories and benchmarks. We also explored public funding options. In phase 3, our most recent phase, we addressed the library agreement and assessed options for alternative governance. And where we're headed into the future, one of today's recommendations will be to engage elected leaders from each city to build upon the work of the ad hoc committee to strengthen our regional library system. As you may recall, during our first phase, we established the following guiding principles: that all residents in Santa Barbara County deserve access to library services, that service levels vary by community needs and library type, and that equity requires consideration of population and other issues. Core operations should be funded by public revenue sources. Friends, foundations, volunteers, grants, and public-private partnerships should be activated for expanded services. Libraries should have secure and sufficient resources to meet community needs. Support services provided by main libraries enhance branch libraries. Library decision-making should enable flexibility for library directors, as well as transparency, accountability, and opportunities for input from the community. And increased collaboration and coordination in terms of budgets, library organization, and programming will have system-wide benefits. Key findings from our first phase were that our libraries are valued and valuable. They serve important core community functions. And that we found our libraries were underfunded relative to California and United States libraries. As an update since phase 1, and in recognition of the board, the county has significantly increased library funding, largely for county branch libraries, by establishing the Small Library Fund, earmarking new cannabis revenues for libraries, and most recently added a COLA to the per capita for all libraries in the county. Continuing findings from phase 1, the current model of governance is complicated and presents challenges to system-wide planning and problem solving, and that additional work is needed on equity, revenue, and governance. In our second phase, the ad hoc committee split into 2 subcommittees. The benchmarking committee was formed to identify realistic, equitable standards for library services. We reviewed standards from 12 states outside of California. We compared branch-level data from 4 counties, California counties most similar to Santa Barbara County in terms of population, geography, and number of branches. We categorized Santa Barbara County branch libraries based on population, density, and proximity to a main library. And we collaboratively set minimum standards for staffing, open hours, collections, programs, technology, facilities by branch library size. A major outcome of the second phase was the categorization of all county branches and the establishment of recommended minimum standards, such as staffing levels and expertise, open hours, collections, programming, technology, and facilities. Here they are, and on the next slide, I'll revisit our progress. This chart identifies our progress towards achieving minimum standards. We still have a ways to go to meet them. This next chart shows the estimated cost to meet those standards. And while staff is not seeking funding today to implement these standards, we hope to achieve them through further engagement of our city partners. Also in phase 2, the funding working group was formed to identify the most feasible option for increasing public revenue for the countywide library system. This group considered special taxes, general taxes, parcel and property taxes countywide and within sub-county areas. They calculate a revenue potential of each option, outline the steps to proceed, such as assessing the political feasibility of a measure, determining the best option given the current reality and timing, gauge support for the measure via public polling, and build support for the measure with a funded campaign. Now, the committee did not proceed further down this route, but we did find that dedicated public revenue was a key component of many successful library systems. The third and most recent phase aimed to address the annual agreement and governance to do the following. Through our 2 sub-working groups, one on agreements and the other on governance, we aim to do the following. To simplify the system, to clarify roles, authorities, and responsibilities, streamline the annual budget process, standardize and clarify agreements, enhance collaboration and coordination across the system, support countywide library strategic and long-range planning, enhance opportunities for system-level fundraising and advocacy. The agreements working group objectives were to evaluate and propose changes to the current operating agreements between the county and managing cities. Each managing and partner city to engage managing and partner cities to coordinate efforts in library funding within the existing governance and finance system for the fiscal year 21-22 budget cycle. Clarify city and county roles, authority, service expectations, and responsibilities. We implemented the following revisions to the annual agreement. In general, minor edits were made to more accurately reflect the current conditions and processes, such as auto-renew of our library advisory committee members. We established a new timeline for the county to work with partner cities and significant contributors to document total funding available for library directors' budgeting processes for branch libraries. We added new language for the cooperative library system and sharing of materials within the county. We provided additional detail on population allocations within each zone and we set a 25% cap on administration fees with clarification on what could be charged and required documentation. The ad hoc governance working group found that cooperation, joint funding, and efficiencies of scale help libraries to be more sustainable and more equitable. But competing demands within the current governance system makes it difficult to prioritize systematic solutions. As a result, we are slowed down by conflicts and missing opportunities to tap new funds to enhance facilities, program, and equity, engage in system-wide strategic planning and capital planning, further increase efficiency and effectiveness. The working group explored alternative governance options, including the option to create a JPA. The ad hoc governance working group found that a joint powers authority could provide a forum for multi-jurisdictional decision-making and a mechanism for raising dedicated funds for libraries. And that centralized decision-making generally improved performance and equity and reduced conflicts and costs for library systems that were administered as JPAs. That dedicated and sufficient revenue is a key ingredient in other systems' successes. A JPA is not one size fits all and may face barriers. To further explore alternate governance options, the cities would need to be engaged. So what's next? Today we're asking your board to approve the fiscal year 21-22 countywide annual library agreement and to direct staff to engage city elected leaders to engage and educate city decision makers directly to determine priorities, to work in partnership with the cities to increase overall funding levels in order to implement minimum standards across the branches, to assess facility needs across the system, to co-develop a plan with cities to tap new state and federal funding for facility upgrades and program expansion, and to raise awareness of the value of libraries and invest in them as critical infrastructure. We often talk about our unique and complex system. On this slide, I'd like to outline all of the inputs into our system and why the committee is recommending additional engagement for libraries, additional city engagement for libraries. Beginning with funding, which comes primarily from the county, managing cities and partner cities, and to varying degrees at different libraries, community, philanthropy, through friends and foundations. So that's in green. Next, we overlay decision-making in red. Decisions are made by elected officials through the budget process, filtered down through city and county staff to the library directors, and ultimately to the branch leads. Additionally, since all county libraries are within the Black Gold system, decisions made at that level impact the system. Adding in advisory and influence into the system adds another layer of input. Each main library has either a library board or commission. The county has the library advisory committee and the ad hoc committee. City and county staff play an important role as well. Decision makers are advised and influenced by a wide array of communities, boards, and commissions. The last overlay is collaboration and information sharing. We have a very dynamic and integrated and complex system. Engagement of elected leaders is outlined in blue here. County board members and the 8 cities would be activated and engaged to build upon the work of the ad hoc committee and would be supported by county and city staff, the 4 library directors, a library advisory committee member, and a Friends representative and a facilitator. Elected leaders would be invited to attend future ad hoc committee meetings with the goal to engage cities and allow an opportunity to assess needs, discuss city and county funding contributions, and develop a plan to tap new state and federal funding. It would not replace the existing governance, but would promote collaborative problem solving and planning. It would continue the ad hoc committee's work to chart a course to implement minimum standards discussed earlier, consider potential new public revenue sources, consider alternative governance and advisory structures that could support ongoing joint decision-making and long-range planning. The California State Library Report, measuring the value of California's public libraries, found that libraries are important and a great investment in your local community. For every $1 invested, between 2 and 10 are returned, with an average between 3 and 6. And that investing in libraries yields valuable dividends through social value to vulnerable populations, personal economic development, crisis response and community resilience, personal learning and knowledge development, and development of social capital in communities. Libraries have been a source of community resilience and support during the pandemic and will be critical to the recovery by bridging the digital divide, addressing learning loss, aiding job seekers and small businesses, and that elected leaders can partner with libraries to expand internet access and support distance learning, leverage library resources to assist vulnerable populations, impacted workers, and businesses, and ensure libraries have the resources needed to maintain services during and after COVID-19. Thank you for your time. Here are today's staff's recommendations: to receive an update of the work of the Library Ad Hoc Committee, direct staff to invite elected officials from each city to attend future meetings of the Library Ad Hoc Committee, to approve, ratify, and authorize the chair of the Board of Supervisors to execute a one-year agreement for operation of a countywide library system, and determine that the above recommended actions are not subject to CEQA.
Thank you, Mr. Ryder. Questions from the board? Before we, look like there's no questions at this point. Madam Clerk, do we have any public comment on this item?
Chair Nelson and members of the board, we have no request to speak.
Okay, back to the board. Supervisor Hartman.
Well, I just want to thank Ryder and Mr. Chapchin for the tremendous support you've given to this process. We have the model that we have for our libraries in Santa Barbara County is not modeled anywhere else in the state. And it's evolved, and people are committed to some version of this. So we can't wholesale change it. So we've got to figure out how we can better make it more efficient and leverage our resources. So I think this has been an incremental process, but we've learned a tremendous amount, and Legacy Works has done a terrific job. And each of the main city libraries has a zone administrator, and they've put in an enormous amount of time helping us to benchmark and better understand. I thought we paid for a library study, and that was kind of it. And then there's just layers and layers and layers more to understand. And our goal over time is not necessarily to have an integrated system, but at least to have a framework that can allow us all to accomplish more together and sharing resources and knowledge and trying to improve the services available. I really appreciated, Mr. Chapchin, your introduction. A lot of people wonder, gee, are libraries still important in this day of computers? And I would say that we learned they're even more important because there are fewer, it's digital access, but it's also a community center and places where people rub shoulders and feel part of where they feel like they belong somewhere that's really significant to them. So we had an opportunity yesterday to celebrate the new book van that Goleta Library has put together to serve Isla Vista, and there were a lot of people there really, really excited. And it's going to be going, it's got, you can download digital books and programming and things for all different ages in Isla Vista. And so that's just an example of how a library can kind of weave a community together. So this strategy is our best effort to think, how do we take what we've learned and share it with our city partners and figure out what is the best strategy. Our libraries are underfunded, and as was mentioned, we really don't measure up to the average library in the state or the country. So how we're going to address that over time is something we all need to wrestle with. But at least I think because this board has understood and contributed more money, that we all are huge supporters of libraries and want to make this system work and work even better.
Thank you, Supervisor Hartman. Supervisor Hart?
Yeah, I agree with Supervisor Hartman. We are all strong supporters of the library system, and I think this is our best opportunity to engage more of our elected official colleagues around the county to help in a regional effort to find a path to increased funding for libraries. It's not easy, and it'll take a lot of collaboration, but I really appreciate the work of the Library Ad Hoc Committee. To date, you've built a great foundation, and I think this is just taking it another step forward. And I welcome the work and contributions from other elected officials to this challenge.
Thank you, Supervisor Hart. Supervisor Williams?
Well, I also want to thank Ryder and George. We've had great staffing on this, which has really helped us transform, a matter that was that involved a lot of conflict because everybody wanted their libraries to thrive into something that's been a real productive discussion. I think the facilitation of meetings has also helped in that regard. I just want to make sure the board keeps their eyes on the benchmarking process and sort of what that indicated. And the comparison of funding analysis that was done. Comparison funding analysis, did indicate that we have even after the increases that we put in, we still have a relatively low level of funding. And that the benchmarking said that, we're meeting what we would consider objective standards in some places, but not meeting them in others. And so I think we have to think about what's the solution in the long run, and it's not going to involve, it's going to have to involve money. Is the solution some kind of dedicated funding mechanism, or is the solution that we haggle with the cities and the friends groups about how much each person can pitch in to meet the benchmarks? But I think we're going to eventually have to go one of those routes if we want to fully realize what I think is just a positive development in general, which is that an area that everybody cares about gets its due attention, which I think has helped in and of itself. But let's keep our eyes on what the next step might be.
Thank you, Supervisor Williams. And great presentation, Ryder. This is very good. It's great to see the progress that's being made. I'm really interested in seeing the cities engage more through this. That's one of the things that when I look at this, obviously this board, not just the five of us, but historically has made a commitment to libraries no matter where you live in the county. So we've contributed to both municipal and branch libraries proportionally. And that is, I guess, the unique model that we have in Santa Barbara County. That historical practice has created some inequities. And I hate to get myopic here, but I represent a community, Orchid, who has the lowest per capita contribution to libraries in the county, and it's not even close. Most of the libraries in our county have actually twice the amount of per capita and up to 6 times the per capita contribution to their library for their residents. So unfortunately, when we go into this elected leaders forum, what the elected leaders for Orchid are the 5 of us. They only get to elect me, but it's all 5 of us. We are the municipal government for Orchid. I plan on doing a presentation eventually on Orchid for our board. I'm gonna put that off for a little bit, but I do want to say, there's the same amount of people in Orchid than there is in the city of Goleta, according to the census. And I think people don't get that. The amount of sheer mass of people with very underserved. We've been able to use them as a housing repository for the county, but it's still a community that needs these things. And I think there's a responsibility that's on this board, now and into the future to realize that, to acknowledge that, to try to find revenue sources to close some of those gaps. So libraries is going to be one of the big ones I'm going to be pushing for. I know I've been advocating and I've gotten some support from my colleagues on actually building a permanent Orchid library and community center. That's something that I think is a first step. But even once that's there, we look at these numbers of per capita, and that doesn't go away just because you have a library. So I'm confident that my colleagues who will be on this elected leaders forum will be keeping that in mind as we move forward. I'm interested in advocating for that, and that's kind of my piece here. I know Orchid does have a communities facilities district that I think might be able to be reworked to have some of that money more invested into libraries versus some of the other things that the county has chosen to invest those funds in the past. I'd like to take a look at that as we move forward, but just since we're agendized to talk about this, I just want to make sure that I mention those things. I think it's a big problem when we look at the whole entire picture, and I think it's something that we should all be engaged on trying to see if we can't fix moving forward. Supervisor Hartman.
Well, I just wanted to add that Orchid and Guadalupe are the two that have to pay rent. They don't have a county building, and so that really puts them at a disadvantage. And both, I think, are in desperate need of finding a permanent home that works. I think we're all tremendous advocates and want to help Orchid get adequate library services and more. I just wanted to point out the slide 9, where it distinguishes between medium and small and really small libraries. We didn't say every library has to have everything. We really worked hard to say what's appropriate for these different levels, and that it was some hard choices to come up with that. But I think it shows discipline. It shows kind of a practical realism. But many of it's really important that you have 2 staff people, though, at any library just for safety reasons, and we don't have that even now. So we have to give a lot of thought to how we manage our libraries and what's needed at different size libraries, and then the capital needs, because even though we may have libraries, other cities have library buildings, many of them are in really poor condition, and we need better technology. And again, they are community centers, like Chair Nelson said he's aspiring to in Orchid. They serve where people have meetings and presentations, and so they've got to have that function, the space to support that kind of function, because it supports community.
Thank you, Supervisor Hartman. All right, it's great comments. Back to staff.
Chair Nelson, if I just also could emphasize, for people who are watching this, the public, the board really has put a lot of money into libraries. It's not like it's underfunded because we haven't been putting money in. The board has been put a lot of money in, but our system is so unique that we're funding city libraries as well, when most counties don't do that, and they put it into their county system. So hats off to the board, because you have provided a lot of money for libraries, and it's across the board, and every resident's considered a county resident here. So it's not that we're underfunding it, it's just, the system is that much bigger than most counties would take on. So I just want to clarify, so people don't think that the board is underfunding.
Yeah, I think the greater point for people, that are watching or listening, or the media, is that, the county has done its share and more, but there's some cities that probably needed to be bigger players in this, and that's what hopefully we'll be seeing out of this elected leaders forum, is a buy-in to that concept. And that's not all cities. Some cities have been very generous as well, so keep that in mind. All right, we have a motion for staff's recommended actions. I believe, let's bring that up real quick. A through D.
So moved.
All in favor signify by saying aye. Aye. Motion passes unanimously. Good to see you both. All right, moving right along. Departmental item number 4.
Chair Nelson and members of the board, departmental item number 4 is from First 5 Children and Families Commission. It is a hearing to consider recommendations regarding child care relief and recovery, American Rescue Plan Act, ARPA discussion.
All right, I believe we have, Wendy Sims-Moten and Michelle Robertson.
Yes, I'm in Santa Maria.
There you are. Welcome.
Hi, thank you. Good afternoon, Chair Nelson and members of the board. Thank you for the opportunity to speak briefly regarding child care sector needs during COVID-19. As you hear and read, and perhaps have even personally experienced these past 18 months, how the impact of the pandemic on the child care sector has affected both parents and providers. The presentation during this workshop will include some local and state statistics for you to consider. Today, as a part of a three-pronged approach of recovery, relief, and response, First Five is here along with representatives from the Santa Barbara Foundation, who have led the Emergency Child Care Initiative, also referred to as ECCI, for the past year. Joining me today from First Five, Assistant Director Michelle Robertson and Senior Project Manager Cheryl Beaker, Zoom. And also I would like to introduce Dr. Pedro Paz, Director of Grant Making for the Santa Barbara Foundation, and Dr. Holly Goldberg, an early childhood and data consultant, to speak briefly on relief and recovery strategies. Santa Barbara County Emergency Child Care Initiative started in partnership with the United Way, the Santa Barbara Foundation, and several philanthropic partners to offer funding for emergency child care programs in response to the urgent need to provide safe child care facilities for essential employees in Santa Barbara County during the COVID-19 outbreak. First Five Santa Barbara County is committed to working with functional group partners under Human and Health Services to design a plan for response with the Office of Emergency Management to address child care sector needs during crisis, which includes disaster training, data gathering, and materials and coordination of supplies. Coordination of supplies was so critical during the COVID-19 that we were very fortunate to be able to partner with State First Five California, who distributed many pounds of PPE supplies. And I would like to thank our local community partners who worked tirelessly to distribute those supplies to our local child care providers to ensure everyone's safety while providing care for children. Thank you again for the opportunity to address the board, and I will now turn the remaining part of the presentation to my colleagues, Dr. Pedro Paz and Dr. Holly Goldberg.
Welcome, Ms. Goldberg. Mr. Paz.
The Board of Supervisors. As you've already heard, my name is Pedro Paz. I'm here representing the Santa Barbara Foundation. As some of you are aware, the foundation has a history of supporting childcare in the county and is a current, very significant part of our current strategic priorities. We provide childcare scholarships to working families through our William and Lottie Daniel Fund, provide grants to nonprofits to increase the quality of care through our childcare grants. In addition, most recently, as Ms. Sims-Moten mentioned, we supported the Emergency Child Care Initiative along with First Five, for which we are here today. In this effort, we have addressed the needs of child care providers by funding a coordinator position in the way of Ms. Goldberg, so that the child care sector can respond to the needs of the pandemic. As a result of the ECCI efforts, a supportive alliance was established among early care and education partners, along with the Public Health Department, Office of Emergency Management, Community Care Licensing. These organizations partnered together to support compliance with health and safety guidelines, as well as the rollout of vaccines to childcare providers. What you may not be aware of is that we have done this because we hold the belief at the Santa Barbara Foundation that childcare is a critical piece of our economic infrastructure and an essential ingredient to our county's workforce ability to return to work. Moreover, as many economists have argued, not doing anything to help this sector get back to pre-pandemic childcare levels will affect gender equity in the labor market, as well as potential GDP for years to come. In other words, this industry is a key to our recovery in our county, and not doing anything will hinder our progress. As you read in our report, we will play the role of fiscal agent to this collaborative if funding is received. We have an existing program and fiscal infrastructure at the foundation to act as a fiscal agent for receipt and distribution of funds, and have already done that with the county and a number of other municipality grant programs. In addition, we also will play a few other roles. We'll continue to play a funder role. We will dedicate 1.5 FTEs to childcare. In addition to the grant programs I mentioned, which provide nearly $500,000 a year in funding, we will make investments in childcare workforce. We will solicit and engage additional funders, facilitate funder collaboratives, and funder education in this area. We will continue to advocate for increased access to early learning programs, advocate for support of early care and education workforce, engage our statewide philanthropic networks to support childcare-friendly state policy and budget allocations. We will advocate for increased childcare subsidies. Moreover, we will equally continue to support this collaborative as this work progresses. As mentioned, we will dedicate staff time to help lead the development of a detailed plan for receipt of ARPA funding. We will coordinate and assess childcare workforce development strategy along with First Five, Childcare Planning Council, and our Resource and Referral Office. And we'll continue to support the convening of childcare leadership in our community, which we've done through a directors collaborative and this collaborative that we're talking about today. Lastly, I would like to end by stating that we at the foundation look forward to partnering with the county in this important work and in other areas. And you can always count on us to be a partner in your work. Thank you very much.
Thank you,
Now I'm
Mr.
going to turn it over to Ms. Goldberg, which I believe she's online.
She is.
Thank you.
Thank you, Mr. Paz. Ms. Goldberg?
Thank you. I'm going to walk you through a PowerPoint today. Good afternoon. I am, as you've heard, the project manager for the Emergency Child Care Initiative, which, as you know, is funded by First Five, Santa Barbara County, and Santa Barbara Foundation. It's my pleasure to be here today to discuss how our local economy can recover by investing ARPA funds in childcare. We spoke about this at public comment in June, and we were asked to return today for this study session. I will illustrate during this presentation and via the report that was previously submitted how Santa Barbara County's economic recovery from this pandemic is dependent on childcare, a sector which has been hit hard and needs your support. The Emergency Child Care Initiative formed in March of 2020 and has helped to ensure that essential workers had childcare available to them so they could continue to serve and support our community. As the pandemic progressed, we convened county, state, and local organizations to coordinate data, information, and resources to help our local agencies and providers navigate the complexities of stemming, not spreading COVID-19 so that children could continue to learn and grow, parents could work, and childcare programs could stay afloat. Because of this collaborative work, our community has lost far fewer childcare programs than other counties. Yet, even with this intensive support from the Emergency Child Care Initiative, programs have struggled to maintain operations and have not been able to overcome the financial toll of this pandemic. Now more than ever, our local childcare programs need help in order to keep their doors open. Next slide, please. Thank you. We are here today to ask the County of Santa Barbara to consider contributing $2 million in ARPA funds for immediate relief and recovery for the childcare sector. We are also asking cities to collectively contribute $500,000 towards this effort. ARPA funding will provide immediate relief grants to private childcare programs to reduce revenue loss, ensure continued operations, and avoid closures. Additionally, comprehensive recovery support and TA will be offered to all childcare providers. This will include continued assistance navigating the ever-changing health and safety guidelines, as well as support to secure business grants and other funding. The proposed ARPA childcare relief and recovery strategies target critical needs that are insufficiently addressed within the state and federal budgets. Next slide, please. Throughout this pandemic, we have seen it in the headlines and we've all experienced it, whether personally or via our colleagues. Childcare impacts everyone. The proposed ARPA support is critically needed to stabilize the childcare sector, support parents' ability to return to work, and support children's healthy development. As you know, the developmental, cognitive, and social emotional benefits of high-quality childcare for children are critical, particularly during times of stress and challenge. Plus, without access to high-quality childcare, substantial portions of the workforce will remain unemployed, reduce their hours, and leave the labor force entirely, which will further diminish the pool of potential workers in the region, decrease household incomes, and lower the economic appetite for regional spending. The viability and recovery of other business sectors is dependent on parents, especially mothers, being able to access childcare so they can return to work. The lack of affordable quality childcare spaces for children aged 0 to 5 in Santa Barbara County is a serious issue during normal times. The past year and a half revealed how this everyday challenge has the ability to devastate our community during disasters. Childcare providers have been our unsung heroes throughout this pandemic. They pivoted to serve essential workers. They opened their doors despite schools being closed, and they operated with decreased revenue and increased costs. They are exhausted, financially strapped, and now, like many sectors, are faced with a limited workforce. In our recent survey of local childcare providers, one provider wrote, quote, "Prior to the pandemic, our program could financially support 5 open classrooms, 12 teachers, and other budget expenditures, as well as stay open until 5:30. Now we're down to 3 classrooms, 4 teachers, and closing at 3 p.m. We're not covering payroll. Every month we dip into savings to cover payroll and other expenses," end quote. Another wrote, quote, "Just because we can open doesn't mean we have the same revenue as before. We are tuition-based, and I don't want to let any of my staff go or reduce their hours," end quote. Private childcare providers who do not contract with the state or federal government have received a fraction of the support subsidized programs have received over the course of the pandemic, creating substantial financial hardships and risk of closure. Now, the Center for American Progress calculated the cost of providing childcare that meets pandemic-related state guidelines and estimates that in California, there's been a 54% increase in operating costs for childcare centers and a 75% increase for family childcare programs during the pandemic. In our recent survey of local providers, the average lost revenue for private childcare centers is $68,000 and $14,000 for family childcare programs. It would take more than $3 million to recover the lost revenue just for those that responded to our survey, which only represents about a quarter of our local private childcare programs. Now, our team of specialists have been tracking potential funding from the federal and state budgets for childcare. And although there is some financial support for subsidized programs and family tuition subsidies in the federal and state budgets, there's only a nominal amount of financial relief allocated to private, non-subsidized programs. These private programs are on the brink of financial collapse, and without an infusion of support, they may close, which would devastate our community's recovery from the pandemic. Next slide, please. When we talk about supporting the childcare sector, we're also talking about supporting women. The pandemic brought to light the inequities women face at home and work. The majority of childcare businesses are owned, operated, and staffed by women, many of whom represent minorities. These women, they have been the backbone to Santa Barbara County getting through the pandemic, while also doubling down on their own childcare responsibilities. Of those who left the workplace this past year and a half, 80% were working mothers. This mass exodus of female talent and expertise from the workforce is crippling our economic recovery. One of the most effective ways to address this is to provide relief and support to our childcare sector. Next slide, please. Let me conclude by summarizing why this, why now. First, as we all know, we are at a critical juncture in our recovery from the pandemic, and Santa Barbara County cannot fully recover without childcare. 2, the proposed strategies directly address ARPA's objectives and guidelines and can be completed in the 3-year timeframe. 3, This proposal will fund an immediate need that is insufficiently addressed and plays a key role in the multi-layered federal, state, and local approach to restoring childcare in Santa Barbara County. 4, the proposed relief and recovery strategies align with what other counties and cities throughout California have approved and are in the process of approving. 5, an amazing partnership and a strong infrastructure are in place to ensure successful implementation of this project. And we have endorsement from many community organizations, excuse me, including the Santa Barbara Central Coast Chamber of Commerce, the Audacious Foundation, and Legacy Works. 6, excuse me, the private sector has primarily led this effort until now, and it is time for local governments to consider joining by allocating ARPA funds to childcare relief and recovery so children have safe, stable, and equitable environments to learn and grow, and so parents can return to work and rebuild our economy. Now, before I end, I'd like to read you a quote from a recent report from the Center for American Progress. And I quote, "While the majority of childcare programs are private businesses, the service they provide is a public good. Not only are they a key part of the infrastructure that supports the current U.S. workforce, but they also play a significant role in shaping the future workforce, harnessing the potential of young children during a critical period of brain development and setting them up for a lifetime of learning and social interaction. Nothing less than the future economic prosperity of the United States is at risk if we fail to support childcare providers and educators throughout the pandemic and beyond." End quote. Thank you for considering our proposed allocation of ARPA funds for this unprecedented opportunity to rebuild the stability of our economy by shoring up our local childcare sector.
Thank you. Supervisor Hart?
Well, I just want to thank everybody who presented today, Ms. Sims-Moten, Mr. Paz, and Dr. Goldberg, because that was really a great presentation. I think it really succinctly and clearly identified the challenge and proposed a path for us to help arrest what we're potentially facing, the brink of the collapse of the child care system in our county. It's a miracle that through the efforts of everybody working together, that cliff hasn't already been reached, but we need to be deliberate and really consider this. I know we're not actually making the recommendations today, but this is a great precursor to understanding the extent of the challenge and what this proposal would do to affect that. And I really appreciate the information. One thing I am a little uncertain about, just like a little bit more clarification, is the decision-making process that will go forward. If this money is allocated, there's a consortium that's being proposed to allocate this funding. Can you give me more details exactly about who? I think it's the Child Care Referral Agency and First Five, would be allocating the funds. Maybe just give me a little bit better understanding of the decision-making structure of the organization.
Sure, I'd be happy to do that. It's a great question. The Emergency Child Care Initiative is a partnership and a collaboration, as I've mentioned. The partners right now include, and I'm going to name them just in random order, Santa Barbara Foundation, First Five Santa Barbara County, Children's Resource and Referral of Santa Barbara County, Child Care Planning Council of Santa Barbara County, and United Way of Santa Barbara County. I think that is our core organizations. And so through the process of consensus, this group will lead the effort and move forward in making sure that there is this continued strong infrastructure in place to oversee the project implementation.
So those 5 entities, through a process of consensus to make the decisions about the financial allocation of the grant funds and future strategies. Mr. Paz, you had something to add to?
Yeah, Supervisor Hart. I believe you were asking how we would distribute funds as a fiscal agent and the ability to run a grant program, which we've done for the county for small business. And we did through the COVID pandemic. We will readily be able to do that. We will work with our partners to identify and allocate that funding to the appropriate recipients of funds, but we're ready to do that, and we have done it through the pandemic.
But the decision-making about the grants will be through this collaborative
Correct. Yes.
group decision-making process. Okay, thank you.
Yes.
Excuse me, Supervisor, thank you, Supervisor Hart. Supervisor Williams?
So I think this is an enormously important subject, and it's been an honor, of course, to serve as one of the first 5 commissioners to see it a little bit up close. I love both of your work. I'm kind of, though, interested in how this would work and how it fits in with what the state's expansion of subsidized childcare is. So how does that affect what's going on, I guess, is one question. And it seemed to be then alluded in the presentation, and the purpose is to maybe complement that by attempting to make sure the market rate doesn't sort of collapse. And then my sort of the third question is, why wouldn't a direct incentive for new childcare slots work to accomplish this? Because, you know, when you're talking about a $2 million request, that would be enough to subsidize 1,500 families for $100 a month for a year. So why wouldn't that accomplish the same thing?
Those are excellent questions. Let me see if I understood you correctly, and I'll begin with the first question about the state's expansion and actually, I'm not exactly sure what the question there was, but I can speak to the difference in the state funding that's coming down for subsidized spaces versus that which has been available to non-subsidized spaces. And with that, there was the question about the market rate not collapsing. And right now, these efforts are really in kind of stopping the bleed so that we don't lose programs. We've already are at a deficit with programs operating at a lower capacity than what they normally operate at due to our small cohort sizes, not being able to enroll to full capacity, having to have more staff available, and the extra cleaning expenses. So with that, programs aren't operating at full capacity. They're not able to serve as many children as before, and we have programs that have closed. So our goal right now, instead of adding more spaces and incentivizing more slots, is to just stop the bleed, make sure that we reduce the number of programs that close, and make sure that the programs that are open can serve as many children that they are licensed to serve in a quality setting. Now, as far as the comparison between the support that's available for subsidized programs versus non-subsidized programs, it's a really important point to make in that there's been quite a bit of support available from the state and for subsidized programs. I'm going to pull up my numbers here so that I can refer you exactly. If we have a comparison of a childcare center that serves 60 children, let's say, and that program is subsidized versus a childcare center that's not subsidized, it serves a similar 60 programs. The subsidized program would have been able to receive to date $74,000, whereas a non-subsidized program would only have access to $6,500. And so what we're trying to do is to make sure that those non-subsidized programs don't close because of the financial toll that this has been taking. As far as your comment about incentivizing family subsidies, there are state and federal family subsidies that are available. And so what we're trying to do is target unmet needs that are not being met from other funding sources. I hope I answered all of your questions. Please let me know if I didn't get them all there.
Yes, thanks. Thank you, Ms. Goldberg. And we also have somebody here. Would you mind introducing yourself? And
Yeah, good afternoon. I'm Michelle Robertson. I'm the Assistant Director of First Five. And Supervisor Williams, through the chair, I think I could answer some of your questions. So as you know, part of First Five's role is to track the legislation, and we've been watching closely the governor's plans on expanding early childhood education. In fact, today, there was just a press release that he did sign the universal transitional kindergarten expansion. So that will be available to all 4-year-old children starting next year and being fully implemented by 2025. That is a great thing. We're very excited about that, but that's a 4-year rollout. And so we're looking for how can we serve the children and families right now. Part of the challenge with the private centers is that they have not been able to access the same supports as subsidized programs, as Dr. Goldberg has said. With this incentive to keep them open will also be conversations on taking some of those subsidized slots into their programs so that they can access, so they can expand for children who qualify. And so, as you know, the child care system is fragmented, complicated, confusing, ranges in terms of quality and who serves who. And so we will work with the providers to make that less confusing and try to make it as seamless as possible. Did I answer what you needed?
Yeah, I mean, I think one of the central difficulties of this proposal, and maybe why I'm unsatisfied with the answers, is, you know, you guys are saying that the problem is that they aren't operating at full capacity, but your solution isn't for them to change their level of capacity. Your solution is only to hold steady in the amount. You've said that your goal is to target unmet needs, but what you're proposing to us isn't actually to target unmet needs, right? Because you're saying we're not going to get any more slots out of this.
So I can answer it in the simplest of terms is we can't expand the slots if the programs don't exist. So when Dr. Goldberg's talking about stopping the bleed, it's trying to keep the programs just to stay open from there, and then to get back to their full capacity, and then look at expansion. And so, yes, I think that there will be an important need for some more subsidized slots. So those that don't qualify for state and federal subsidy, we could offer a local county subsidy through either this fund or funds that are already in existence through the Santa Barbara Foundation or United Way. But we first have to make sure we don't lose any more, is what we're at right now.
Yeah, I just think the difficulty for you guys operating these grants and the difficulty for us is how do you assess accountability here, right? If there's no discernible product, i.e. you can't say we have this many slots because of what we did, how are you proposing to show us accountability for the money, and how would the individual child care operations demonstrate need and accountability to you?
And I'm going to agree that those are really good questions, that we have had those discussions internally, because we don't have any control over private businesses, right? They could apply for the stipend and could close the following month. So we do need to have those discussions and work that out. Just want to be transparent.
Well, I just say that I very much think that there is a dire need in childcare, and I don't know what the secret sauce is. There's weird stuff going out there, right? There's people who can't find childcare, and yet there's family centers that are empty, right, with people ready to go, right? So I mean, there's weird stuff going on out there that is hard to discern. But I do think that working on what the result would be is really important for us, especially considering, we're going to be presented with other life and death needs in homelessness and mental health, in other areas. And I very much believe that I do believe there's a lot of unmet needs out there in childcare. And I want to know know if there's a way to know that this puts us on the path to meet those unmet needs. If you know what I mean.
Yeah, Mr. Paz, and then we're going to go to Supervisor Hart, and I have some questions as well.
Supervisor Williams through the chair. We have a bit of experience doing this at the foundation when we were at the height of the pandemic. We went through 65 cycles of funding nonprofits in our community, in our county. And we had to make the exact same decisions that Supervisor Williams is asking us to do right now. Pitting one nonprofit versus another, which one's more viable, which one do we want to support, which ones do we just say, we love you, but we can't support you. And so that is a challenging question that is both science and art. Part of it is you can model it, you can look at who's going to survive, but you also have to look at the intangibles. And that's part of what Dr. Goldberg was talking about. When we look at this, part of what we're going to do is also provide technical assistance and training to those providers. So it's not just here, fund, we're done, we walk away, but it's also how can we build you back? How can we continue to strengthen your work so that you are in a better position than you were before? One of the things that we've learned during this pandemic is that this pandemic laid bare the fact that this sector in childcare is not really equipped to deal with another pandemic. And we as a county can't afford to do that again. We have heard a number of times, as you have heard, we're more than likely going to experience another pandemic in our future. We want to be better prepared to do that. We want to have a workforce and the childcare sector to be able to respond to that in a way that's both strategic and provides longevity and viability in the sector. So I hope that answers a little more of the question. Thank you.
Thank you, Mr. Paz. Supervisor Hart, and then.
Yeah, I think Mr. Paz did a great job answering the question that Supervisor Williams asked. And maybe just as a way to conceptualize this sector, the private child care providers, serve that missing middle that would be the housing analogy. Folks who do not, who make too much money to not receive subsidies for housing, but have a tremendous crushing need for help with housing assistance. This is the same group of folks who make, they're working two income earners in a family. They need to provide get child care, and they don't receive subsidies to get subsidized child care. So they have to go out in the private marketplace, and these providers are barely getting by and are on the risk of going under economically because of the dislocation of the economy and all the things that are affecting all other businesses. But the critical reason to support childcare providers is without those childcare slots, the people that are being served by those providers, albeit in a fragile economic place, will go under, and there won't be childcare slots available for them. So it's not a matter of growing the marketplace at this point, although that would be great, and that would be the dialogue we'd be having pre-COVID. Now it's a matter of holding on to the existing universe of childcare providers, lest we have a huge loss of supply and a real catastrophe that will impede the economic recovery that we're all trying to create.
All right, thank you, Supervisor Hart. And I'm joining some of my colleagues here and still struggling with the relief portion of that and what that looks like. We had the two different pools there, the $1.5 million for relief and $500,000 for recovery. I would have actually been a little bit more supportive if that was flipped. Because I want to see the growth here. And I understand what Supervisor Hart said, and that Dr. Goldberg is mentioning that there are child care providers that are on the verge of collapse. And I don't know how we figure out that stress test to figure out which ones are going to collapse, which ones are healthy, and how we do that. And that's going to be one of the challenges I think that you're going to have in this process. And I like to be a little bit more secure before allocating that funding, that is a real program and not just, cash grants are great, and I understand that, but as Ms. Robertson said, we don't don't have any accountability on that. So, that's where I'm at on this. I'm not 100% there. I'm really big on the recovery side. What else can we do to even strengthen those existing providers with support services, insurance, whatever is out there? Can we work those things together? Training. How else can we help them so that they don't have to spend those costs out of their own profits or the revenues? I think that's a great idea. And then, I was brainstorming, turnkey programs, something like a, childcare business in a box, and helping somebody get started with that, and mentors, right? Existing childcare providers that can help mentor new small business owners into this market. I think those are all things that we should be looking at, trying to spend these funds towards. One of my goals with ARPA funding is I want to look back after 3 years and have seen the impact. And I know when we were bleeding, you're saying, hey, we just got to make sure we get a tourniquet on this thing. And I appreciate that, totally appreciate that. But I do think there's an opportunity here as well to look back and go, wow, that was a significant investment. We stopped the bleeding and we built on it. And so that's what I really want to see in that $2 million investment from the county, is not only stopping the bleeding, but to really build upon that. This board is committed as their number one priority of this new long-range planning staff member that we hired to work on childcare zoning and trying to see if we can help you on our end. I've talked to council members in other communities. I know Goleta is doing some important things right now on trying to embrace that even into future developments. So those things are pre-considered. I think that's something that we should be thinking about as well, especially among big developments that we bring into our unincorporated areas. So, I think we're just going to need to be a little bit more comfortable on where those funds are going to go. It's a lot of money. It needs to be expended in 3 years. And I think there's a temptation that we just need to get it out there because that's what will stop the bleeding. But I think we want to be a little bit more surgical, if you will. And I think that would provide a lot more confidence for the board. Supervisor Hartman?
Yes, I guess I have some questions, excuse me, about the nature of the bleeding. I know in the houseless, we could only have a third of the people we would normally bring in. And is that what's happened to childcare? Because at least in the houseless, unsheltered, I think they're up now to full capacity again. And is that not the case with childcare? And I believe private childcare were entitled to CARES funding. I know one that did get 2 waves of funding. So I'm trying to understand better the source of the problem, and you just not subsidized and non-subsidized, and there's a dollar difference. Can you elaborate for me?
Sure. So all licensed childcare, whether you're subsidized or non-subsidized, is bound by community care licensing and the State Department of Social Services, right? So they're the ones who set the ratios, the group sizes, and the pandemic mandates. And so they have not lifted any of those restrictions. Children under the age of 5 are still wearing masks. They're still expected to stay a certain amount apart.
Okay.
So say a classroom was licensed for 20, they still cannot go past 10 to 12 based on the guidelines. And so that's part of it.
And that's their revenue. Okay, that really helps me.
Yes, so till the state lifts those or changes those back, programs are bound
So
by
do we have any horizon on that?
that. No. Your
Okay.
guess is as good as
All
mine.
right, I know you're tracking these
Yeah.
things, so thank you. All right. Okay, well, I think this is a receive and file. It's a presentation. I think we're going to discuss this more on the 19th, 16th, one of those days, 19th. And so thank you all who have been participated. Thank you, Dr. Goldberg, for your comments. And can I get a motion to receive and file? Supervisor Hartman? Oh, sorry, I apologize. Do we have any public comment on this item?
Chair Nelson and members of the board, we have 4 requests to speak today under this item.
Okay, I apologize, public. Please.
We will begin with Tandra Pitchford, to be followed by Jackie Banta.
Ms. Pitchford, when you're ready.
Good afternoon. I appreciate this opportunity. I'm Tondra Pitchford with the Child Care Planning Council. A lot of good information that you were sharing and good questions. I appreciate your questions. Some of the things that aren't being addressed is when TK rolls out, that doesn't take care of infant toddler spaces. So I'm advocating for ARPA funding. We understand the importance of the first 5 years of life, the early brain development, the science behind the connections that happen in the brain, the explosion of learning that takes place during this time. So those first 5 years set the stage for future learning. So that early learning is critical. And so we understand that we did have a massive shortage of ECE spaces available in our county prior to COVID. And I shared with you a few weeks ago that we had 2 children ages 2 to 5 or 0 to 5 needing childcare for every single space, and almost 6 infant toddlers needing care for every space. So then the pandemic hit and flipped an already struggling system. And then we already talked about what our initiative, our emergency childcare initiative, came together to help support them, help them survive during that time. But it was messy and not sustainable. We struggled to keep up and provide accurate information for our EC programs and the families trying to serve them, or we were trying to serve. We were truly, as they say, building the plane while flying it. And our efforts did pay off. We were able to reduce the number of programs who permanently closed their doors so far, but it's taken its toll. Many of the programs are barely hanging on, like we said. Many are operating in deficit. So that extra staffing needed, the lack of facility space, and there may be rooms, empty rooms sitting there because we're still trying to get the staffing to cover the smaller cohort size. And when one pod closes, we need to have staffing to cover the other ones that are still open. Extra cleaning supplies and protocols. So it comes at a cost. And some programs are asking for waivers to hire teachers who are not fully qualified. And that affects quality and the continuity of care. So it's very complicated and not sustainable. Better system is what we're asking for, a system of sustainability and then funding. And I know you were asking how we will roll this out. Like Pedro said, we have systems in place and we will develop more systems to meet the needs. The funding is coming, but very little is coming for private centers and family child care. And many of them were the first ones to step up and open their doors to offer in-person care.
Thank you, Ms. Pitchford. That is your time.
Okay.
We will now go to Jackie Banta to be followed by Jennifer Bergquist, who is our final speaker.
Welcome, Ms. Banta.
Hi, thank you. Good afternoon. My name is Jackie Banta, and I'm the Chief Operating Officer for Children's Resource and Referral of Santa Barbara County, and I'm speaking in regards to the ARPA funding for child care infrastructure recovery and asking Santa Barbara County to consider contributing. As you will be hearing, and as you heard from our formal presentation, California child care programs have been severely impacted throughout the pandemic with increased operating costs across the board. Children's Resource and Referral has a direct line of communication with the hundreds of child care providers in our county, as you all know, and we can attest to the immense financial hardship that has been placed on the programs and the unimaginable strain it has been placed on the workforce. We also have a direct line of communication with families seeking child care, navigating the trauma that their children have faced, the fears, and the ever-changing workforce challenges. 4 times more women than men lost their jobs due to lack of childcare during the pandemic. And as we know, without access to reliable, equitable, and quality childcare, parents cannot return to work. Food and housing insecurity persists. Child poverty is exacerbated, and the resulting family stress increases the incidence of child maltreatment, substance abuse, and family fracture. Investing in childcare is investing in our economy. Investing in childcare is investing in our community's overall recovery. We ask that you make a commitment to support childcare infrastructure and its essential component to our local economy's ability to recover. I thank you for your time.
Thank you, Ms. Banta.
We will now go to Jennifer Bergquist, who is our final speaker.
All right, Ms. Bergquist, when you're ready.
I'm here. Thank you very much. Thank you for having me today. I am Jennifer Bergquist, and I'm an advocate for quality childcare. I'm in support of the County of Santa Barbara investing in the childcare infrastructure locally, especially now during this period of economic recovery, which has led to so many women staying home with their children. I left my own teaching position as a bilingual teacher at Franklin Elementary School on the east side of Santa Barbara in 1984, when I had just given birth to our first child. My husband and I could afford to do that, but we quickly became aware of the critical growth and development of our newborn baby. Being familiar with the needs of the Latino community and the challenges of its parents working to provide just for basic needs of their children, I encountered a group called Community Advocates for Quality Childcare, which conducted a survey of county employees here in Santa Barbara in 1984. It documented the needs of those with children who juggled their duties at work with families and their needs day in and day out. I just want to share, I'm going to cut through some of this with the urgency here, time-wise. With our second child, we were able to put him in a program run by Supervisor Greg Hart and his wife, Gail Hart. It's the type of private program which is most vulnerable during this pandemic. It's something I'd like to point out, all these private programs. The bottom line is that families deserve the best programs available to foster the optimal growth and development of their children. This pandemic has greatly interfered with their development, as we know, for school-age children and for our small children in this county. We really do need to restore the childcare infrastructure, which has been severely weakened by the pandemic. And I just want to remind you that there's many wise, capable, hardworking women in the Latino community who would embrace the opportunity to return to work as family childcare providers if they could count on training and support from our county's childcare infrastructure. So again, I'm in support of this idea to fund the emergency services and to recognize that our county relies on these people for our economic recovery. Thank you very much.
Thank you.
That was our final speaker.
All right, back to the board. I think we're close to maybe a motion, but Supervisor Hart?
Yeah, I'll just make the motion to receive and file the report. And thank everybody for participating in the hearing today.
That was items A through C, I'm sure.
Second.
All right. I think Supervisor Hartman next had our light on first. So second of Supervisor Hartman, all in favor, signify by saying aye. Aye. Motion passes unanimously. All right. Next item up is departmental number 5. Madam Clerk, do we need a couple minutes for our translator, or are we good? We're good? Okay. All right. Let's keep rolling.
Chair Nelson and members of the board, departmental item number 5 is from Community Services. It is a hearing to consider recommendations regarding further study on workforce housing needs in Santa Barbara County.
All right. Welcome back, Mr. Chapchin.
Thank you. Good to be back. Good afternoon, Chair Nelson and members of the board. So on June 1st, the board heard a presentation on potential uses of ARPA funds. And in that discussion, I think the board wanted staff to come back return with some information on workforce housing. As you know, the county does receive federal and state funds and contributes to local program funds towards development of affordable housing. Prior to COVID relief funds, the county would receive approximately $1 million a year in home funds for affordable housing. We also use in lieu funds, to help offset costs to build affordable housing. Developers sometimes leverage those funds for state low-income tax credit programs. So there are a number of programs available for low-income, affordable housing, but not so much for middle income, as you just heard with the childcare issue. So today, I think what I would like to do is turn this over to Dinah Lockhart, who's our Deputy for Housing and Community Development, and Lori Baker, to just give a primer on workforce housing. It will take more study, I think, probably from a consultant to really do an in-depth dive, but wanted to give you kind of a primer on what it is and what we're doing and what the needs are, and then a request for potential funding. Dinah?
Good morning, Chair. Good afternoon, Chair Nelson and members of the Board of Supervisors. I'm Dinah Lockhart, Deputy Director for Housing and Community Development, and I'm here this afternoon with a number of people from our team, and Lori Baker, Grants and Program Manager, is going to be providing the presentation by Zoom. If she is available, Natasha? Yes, okay. Lori?
Good afternoon. This is Lori Baker. Good afternoon, Chair Nelson and members of the board. I do have a slide presentation, if we can see that. Thank you very much. And as George already mentioned, excuse me, I'm just getting over a cold. On June 1, your board heard from county staff on the eligible uses of $43 million of American Rescue Plan Act funds that will be allocated to the county and directed staff to return with information on a few focus areas, one of them being workforce housing. Excuse me one moment. Workforce housing is simply that, housing for workers. And in a typical market, there is sufficient housing for workers at all income levels. And while there are some subsidies for lower income households, as we will discuss later in this presentation, there is a segment of the workforce that is ineligible for many state and federal housing subsidy programs. This is most commonly thought of as the missing middle, meaning the segment of the population that does not qualify for subsidies and cannot afford market rate housing. Many in this category work in industries that are critical to the infrastructure of a community, such as safety personnel, healthcare workers, teachers, and others. This slide has a lot of information on it, but the conclusion is that an income of over $90,000 is needed to afford a median-priced two-bedroom rental unit or a home priced at $444,400. In 2020, there were 840 homes sold countywide at or below that price, and of those, 13 were in South County. There are certain subsidies available for households below 80% of the area median income. These include developer subsidies that enable the owner to reduce rents, such as the low-income housing tax credit program, and county programs using federal home or local in lieu funds, and tenant-based subsidies such as the Section 8 Housing Choice Voucher program. There also are programs for households above 80% AMI, although they are fewer and primarily for homeownership. These include low-cost down payment and closing cost loans to help home buyers qualify for mortgages. Examples are those offered by the Housing Trust Fund of Santa Barbara County and Golden State Finance Authority. Sweat equity programs such as those offered by Habitat for Humanity, the Coastal Housing Partnership, which offers discounts on a variety of real estate services, certain employer-sponsored housing programs, for example, housing sponsored by Westmont College and Cottage Hospital, and housing created under the county's inclusionary housing ordinance. There also are subsidies for farm worker housing, including the state Joe Cerna Jr. Farm Worker Housing Grant Program and federal programs under the U.S. Department of Agriculture and Rural Housing Services. There are some limitations under the federal programs, such as residency requirements. This slide shows a list of farm worker housing in the county of which we are aware. Note that the county provided home or other funds
toward the development or rehab of many of these properties. The lack of housing inventory is the most prevalent barrier to meeting the demand for the workforce. To increase housing inventory, developers cite the following as primary barriers: high cost of land, lack of community support for higher density housing, lengthy approval process, insufficient funding resources, increased construction costs. In addition, homes used for vacation rentals and second homes and investor purchases for student housing also contribute to the lack of inventory. The county housing element is currently being updated for years 2024 through 2032, which will assess current and projected needs, take inventory of sites for housing construction, assess actions to enhance housing production, and ensure land use controls allow development of housing for all economic segments of the population, including the workforce. The updated housing element must be completed and submitted to the state by 2023. The County Division of Housing and Community Development held stakeholder meetings with affordable housing developers and housing program providers. Staff learned that there are different strategies that can be deployed to create housing opportunities, such as contribute underutilized county-owned land, allow higher density for housing, make the review process more predictable, reduce development impact fees, offer additional building rights and zoning incentives, incentivize ADU development by providing subsidies to lower rent, consider recommendations in the housing element update, study model programs that can be replicated in the county, support state legislation for workforce housing subsidies, support higher incomes and tax credit projects, broaden existing workforce homebuyer programs with additional resources, expand capacity for revolving loan fund for affordable housing production. Other ideas not on this slide include encourage mixed income developments, convert non-housing buildings to housing, use tax-exempt bonds to acquire existing rental properties and restrict rents and income, replicate employer-sponsored housing similar to that of Cottage Hospital and Westmont College, lengthen the affordability periods on housing created under the county's inclusionary housing ordinance, exercise the county's option to purchase IHO units under certain circumstances, such as when foreclosure is imminent, and strengthen the affordability provisions for housing created under state density bonus law and other state programs by amending the county housing code. Slide 14. Workforce housing is a multifaceted issue that is beyond the time constraints of current staffing resources. Engaging the services of a consultant could help the county with reviewing data from various resources, such as the census, SB-KEG data, and the housing element, to identify the workforce housing gap, developing strategies to build on existing programs, exploring the suggestions provided by housing stakeholders, including those covered in this presentation, expanding partnerships to explore opportunities for creating more housing for workforce households, and identifying gaps and strategies. Planning and Development recently issued an RFP for a consultant to assist with data collection and analysis for the 2024 through 2032 housing element update. The analysis will include affordable housing at risk of conversion to market rate, housing stock characteristics, overpayment and overcrowding, population, employment, and household characteristics by age and segments of the population, such as farm workers, large families, female-headed households, people experiencing homelessness, and people with disabilities. P&D's analysis also will be very useful toward the efforts to explore the needs, barriers, and opportunities for workforce housing. Staff is recommending that your board approve the issuance of an RFP to provide further study on workforce housing as described in the board letter and this presentation. This concludes our presentation, and we're happy to answer any questions.
Thank you, Ms. Baker. Questions from the board?
A lot.
Supervisor Williams.
Well, I loved, I mean, this, if I've ever gotten a packet of materials that I thought was worth reading in my time in public office, this packet was super worth reading. I think like it should be kept like on my bedside. Okay, you know, like I want to understand though, do we, I mean, is there any way to get to sort of, if we think about it ahead of time, two birds with one stone, I guess would be the trite statement. Can we discern anything from our own workforce's needs in this survey? You know, is there any value to oversample our own employees so that we can get a little bit more understanding of how that could fit into our program? That was my only, you guys addressed all fronts that I could think of. That was the only thing that I thought of and wondered about.
Supervisor Williams, through the chair, that's an excellent idea. I think that certainly should be part of the data research and analysis as surveying our own workforce. Certainly, I would love to see that as part of the consultant's scope of work, if we can get approval for that.
Supervisor Williams, if I can also add that when we did have conversations with individuals familiar with the Westmont and also Cottage Hospital examples, they did base their whole model on the income levels and the salary levels that they were already providing to employees. So they were very strategic about the price points that they were offering the housing at, and I think they worked backward from there. I will also say that one of the things that made those projects work in both cases was that the institutions were providing land. So in the case of Cottage, they purchased the old St. Francis Hospital as part of that project. In Westmont, they had also, in one case, donated college land, and in another case, purchased a piece of property. Land tends to be the most expensive ingredient to employ housing. So we kind of heard that real loud and clear as well, that there needs to be significant subsidy, although it can be structured so that as units are sold, some of that does get paid back, but there's definitely an investment made by the employer.
And I think Supervisor Williams, I think, you know, some of the deeper dive also would be some of the programs. There are some cities that have already broached this subject and are participating in. They've purchased property and they're leasing it out to employees, and it's an investment for that municipality through CSCDA, I believe, as a JPA. But I think those are kind of important things. And cities have been doing it for executives for a while, as you know. You know, they subsidize their housing to bring them into an area they can't afford. So, I mean, it's done, but not at a bigger scale for workforce.
Well, it's no secret that I hope that the county will emulate the Cottage / Westmont model. And I think the thing I would love to have added into it is just sort of the question, especially if we oversample our own employees, is if you could buy a unit with expanded income eligibility or help financing or a slight subsidy, what would you know, that was on county-owned land, would you consider buying it or renting it? And I think that's just to gauge that kind of interest. You know, I mean, I guess since it's agendized, you know, my vision, and somebody who knows more about housing than me might come up with a better model than this, is partially based, is sort of like a stakeholder version of what the city's program is. You know the city's program. They essentially cover the second down at 2% interest. So they make a little bit of money, and they essentially expand the eligibility for their employees of what they could buy. I wouldn't, my vision would be that of the model except on a county campus, right? Where, we contract for somebody to build units. We sell those units or rent those units to employees. They make, they get an 80% down from a lender. I mean, they get an 80% loan from a lender. They put 10% down, and they owe us 10% at some interest level. And thereby, we expand their eligibility just by us doing a similar thing to the city of covering the second. And potentially, we produce a revenue stream by which the county can help either with more housing to the general public or with the facility needs that we have on the county campus. And of course, this model only works if people want to live there, right? I think that's how it's germane to the study.
All right, thank you, Supervisor Williams. I believe.
If I can, and I think one of the questions we did ask the stakeholders also was, what would be the biggest bang for the buck? And they all said, buy existing, building new buildings is costly. It's easier to buy existing and convert them. So that was something that we'll take into consideration. But again, you're not increasing the housing stock in that respect.
All right, let's go ahead and go to public comment on this item.
Chair Nelson and members of the board, we have one request to speak on this item. We will now go to Linda Honickman.
Ms. Honickman, when you're ready. Linda, we see you. You need to unmute.
Takes a while to find my cursor. Okay.
There you are.
Hello, supervisors. I'm Linda Honickman, Chair of the Housing Committee of the League of Women Voters, Santa Barbara. The League strongly supports the effort by the county to embark on an intensive, affordable workforce housing study to research the housing gap, to identify model housing programs, funding opportunities, and financing strategies. With new funding sources and a greater community awareness of our affordable housing crisis, we have a huge opportunity to reverse the trend of skyrocketing housing costs due to a limited supply. We suggest that for this study, you expand your definition of workforce housing, which the county previously defined as a household making 120 to 200% of the average median income. The staff report lists examples of workers with jobs that are critical to the basic infrastructure: police officers, firefighters, teachers, restaurant and retail workers. They cannot afford to pay market rate rents, but they make less than the low end of the county's current requirements for workforce housing subsidies. In fact, younger police officers and teachers, et cetera, could be considered low income, which is 50 to 80% AMI. As the staff report states, the South County has a high share of jobs in the county, but has fewer housing opportunities, particularly for the lower and moderate income residents. Getting people of all incomes closer to their jobs is better for their mental health, our local economy, and our community's resilience in disasters. We agree with the report that points out the unique barriers that Black and Hispanic households have had that prevented home ownership, and how that has negatively impacted generations of families. But we are encouraged to hear that there are improvements in the lending and mortgage industries that are meant to ensure racial equity. We hope that the study will include that important equity objective. We agree with the stakeholders who recommended higher density and the use of public or institutionally owned land for residential use. The League would also like to encourage the county to apply for funding available through the state and perhaps new federal housing money. And we are encouraged by the intention to explore creative housing programs like limited equity co-ops, employer housing, a county land trust, and using county-owned property for housing. Thank you for initiating this very important work.
Thank you, Ms. Honickman. Back to the board. Any additional comments? I have a few thoughts. Reading this, as you know, I know that Supervisor Williams is kind of a wonk when it comes to this, and I appreciate that I am as well. I find it somewhat frustrating. I felt like we're closer to addressing the homelessness challenges than we are this challenge. I think this one is, a lot of people feel like with homelessness that's always going to be with us, and that we just need to accept that. I don't believe that. I think we really can make significant efforts to at least own or to fix the unsheltered issues in our county. This one, though, I think is going to be is more Herculean, if you will. There's a reason why real estate's expensive here. It's a place where a lot of people want to live. It's the best environment maybe in the world. One of the best places to live, and that's going to attract people, and it's going to make it very difficult for us to be able to have workforce housing. Looking at these numbers here, I found myself in almost every single one of these charts of where my personal and family income is, and it's a challenge out there. If I wasn't able to purchase a home in the dip, I would be significantly strained, and both the rental and housing market. I'm a college-educated guy. Not that a county supervisors become millionaires by any means, but there are some challenges out there that I think we just really need to do everything we can. I think it's also a call to keep an eye on this. Looking at some of these numbers in this report, I know it's the numbers that we had available, but we were looking at I think 2014 assessor data, which had the median household as $930,000 in the South Coast. I don't think you can get anything below the tunnel for $1 million right now. Had Cuyama at $30,000. We went on Zillow, and you can't get a shack for $250,000 in Cuyama right now. So there is some serious issues out there in the ability for people to be able to buy homes. I'm interested in trying to find solutions, being creative. It's a necessity for us, and I'm not all about just subsidized rental housing. I don't want to create a permanent underclass under working class. I really think homeownership is a huge part of the American dream. It's a huge ability for people of all segments of society, no matter race or religion, to move up the economic ladder. And I think that we need to try to find ways for that to happen. I'm really interested in potentially subsidized home ownership programs, incentivizing builders with maybe more certainty and more streamlined process in exchange for qualifying people like our firefighters and our teachers and our law enforcement officers and our county employees and other working class individuals that are essential to our local economy. So those are things I'm definitely interested as we move forward in this. I just want to make sure I provide that comment. And it also, stresses this jobs housing imbalance. I need to have more jobs up in the North County. We need to attract some of the businesses that are down here. I get why you want to be down here, but you can't find more affordable housing for your workforce without them having to hop on a bus for 3 hours a day up in the North County. And we're a very nice place to live as well, as we know throughout the pandemic, since everybody from LA and San Francisco are moving there. It'd be nice to have some people from Santa Barbara to head on up as well. You're already in the club, so. Anyway, those are my thoughts on this. Supervisor Williams?
Well, I just wanted to, look at a couple of the strategies and maybe just put out what I think is at stake. I mean, people differ about what. So the context already was that young families, Latino middle class are both just two of the more prominent demographics that are being exiled in large numbers to other communities and by our high cost of housing. And to me, the context should be put in this, that we say that social equity and racial equity is one of our biggest issues. We say as a society, climate change is one of our biggest issues. This is the biggest determinant of both of those questions. 60% of our emissions in this county is vehicles. This is what governs vehicle miles traveled, right? Is that ironically in the name of saving the environment, we created leapfrog development into other communities, and other communities satisfied our housing demand, and we destroyed the environment in the name of saving it. Meanwhile, exacerbating the racial inequity of our community. I think there's an imperative to address that, and just because it's such a difficult thing does not mean that we can't make an impact by, one project at a time, one initiative at a time. I want to give two interesting projects that should give us hope. I mean, when I was on the city council, we got a spot zone request, and anybody who's a planner know that spot zoning is heresy, but it was a request to rezone a piece of M land residential, and we extracted out of that a percentage affordable to 120% to 200% of AMI, and we got in unfavorable articles on the East Coast that Santa Barbara is creating affordable housing for people who make $130,000 a year. You walk door to door on that project today, you will see a CHP officer, a nurse, a public health doctor, a teacher, another nurse. It's like a poster child project. It's the East Beach Collection if you ever want to visit it. We can make projects like that. Maybe we do need to invite developers to come to us with spot zoning requests. Maybe we need to I know you don't like ongoing subsidies, but maybe a slight ongoing subsidy as the city is proposing at Carrillo and Castillo. I mean, they're basically going to create rental for up to people who make 100, 108,000, I think is the top end. But it's rents that are substantially below market. And maybe something at the next tier is what we need to do. And the Housing Authority does have a couple projects already in the hopper, right? And arguably it also would help with solving the community's angst, right? You might be able to get the community on board with creating this kind of housing if they viewed it as affordable. I think it's hard for a lot of baby boomers to view $3,000 a month as affordable. But on the other hand, I got to tell you, that's pretty good for what's out there these days. I think there's hope. We just have to treat it as an imperative. Treat it as an imperative to meet our values.
Thank you, Supervisor Williams. Supervisor Hart, then Supervisor Hartman.
Yeah, I would just add that I think the presentation and the dialogue here does show how daunting this is. It is a serious challenge, and yet there are tools available to us, and we should take advantage of those. And the obvious one that the county has as an asset is the land that we have, and we should be really smart about that and find out the best model that can help us deliver the product that we're talking about. And Supervisor Williams' example of the East Beach Collective is a great one. There are other ones like that too. And I'm reminded that the City of Santa Barbara's redevelopment agency, affordable housing projects, were the same kind of things. Daunting, overwhelming challenge that, because there was a consistent funding supply from the tax increment, we was able to chip away year by year by year for 20 years and made a huge impact. And if we could find a funding source like that again from the state of California that would help give us a predictable, dependable funding supply to do the projects through the Housing Authority, we could make a dent in this. We might not solve it by the traditional standards of solving a problem that is almost inexorably difficult, but we would make a huge difference for the people who would benefit from those projects and live with them and raise families and contribute to our community. So this is one of those big things our board talks about.
Thank you, Supervisor Hartman.
Well, with SB 8, 9, and 10, it's just gotten more complicated. I know we are going to do a study, and I guess my question is, how will we be looking at the impact and how best to guide that? We have, in addition to some of the tools you've mentioned, I mean, zoning is our real tool, and the only thing people hate more than sprawl is density, but it's coming with these state bills, and so how can we best guide it? It's also tricky, I mean, cars. And we're working, if people had one car instead of 2 or 3 and we had more micro-mobility, that might work to help us as well. So, I mean, you can't look at housing without looking at so many other issues, and some of them are within our purview and some of them aren't. But we need to find some path forward here because the cost of housing is limiting the county, businesses, nonprofits. I mean, we can't get new young talent in because it's just unaffordable. And so we have to figure out ways to deal with that. And so I'm really excited that Supervisor Williams had the idea for this study and pushing this issue. And I have high hopes that it'll get us some Santa Barbara specific ideas.
Thank you, Supervisor Hartman. Okay, I think we've got public comments. Any further comments from staff before we take a motion and move forward?
Just an observation also, Chair Nelson, and you've seen in the papers the last 6 months to a year how housing prices in Southern California have gone up by 17% a month or 20%. It's astronomical, and I'm not sure how young people are going to be able to afford a 1.2 million. Like I saw a listing here for 1.2 million for a 1,500 square foot house. I don't know how a young person can afford that. So I agree, maybe it's housing where the jobs are or bring jobs in, and you also have investors that you're competing with, and that's a big deal too. You've got hedge funds or whatever it may be, the investors are buying these and renting them. We appreciate the discussion, and certainly we'll take a look at this and work on it.
All right, thank you, Mr. Chapchian. Can I get a motion? Supervisor Williams?
I will move recommendations A, B, C, and D.
All right, can I have a second?
Second.
All in favor signify by saying aye. Aye.
Aye.
Motion passes unanimously. All right. So for the purposes of agenda management, I believe we're going to continue departmental item number 6. It's an important item that needs a in-depth conversation from the board. We're missing one member and we've got a little long today. We do have one member from the public still on to speak on this item. I would like to give her the opportunity to still speak. I think that'd be appropriate. Let's go ahead and read the item in the record. Let's let Ms. Verdon make public comment and then maybe get a motion to continue this item. Madam Clerk?
Chair Nelson and members of the board, departmental item number 6 is from the County Executive Office. It is a hearing to consider recommendations regarding COVID-19 health and human services recovery and resiliency strategies.
All right, so let's go ahead and go to public comment. And typically, we only allow public comment when we're continuing an item to be public comment on the continuance. But again, in deference to Ms. Vernon for sticking in there, if you'd like to make any comments related to this item, feel free to take advantage of it.
We will now go to Zoom with Monique Verdon.
Hello, can you hear me?
We can.
Thank you very much. And I appreciate you giving me this opportunity to speak again today. I shared before, I am a teacher. My husband is a firefighter. I was born and raised here, as was my father, in Santa Maria, Orchid area. And I just wanted to share a bit more. I'll start it with a quote by Benjamin Franklin. Those who would give up a little liberty to gain a little security will deserve neither and lose both. Again, and for me, I want to be on the right side of history. I think before someone said how important it is to do what's right, to follow our conscience. And I thought it was interesting how it was stated, I think by Supervisor Doss, that 1 in 90 are dying. I don't think that's correct at all, when I believe there is a 99% average, more than 99% average survival rate for COVID. I also wanted to share quickly that I agreed with one of the doctors who spoke about his concern when false claims are repeated over and over again. That doesn't make it true. I have that same concern, but by the mainstream media and all that's being said over and over again, and the censorship of the thousands of experts who have different perspectives, and yet they are not profiting. They don't have these vested interests of profit of billions of dollars. These experts who are speaking out, risking their careers, risking their lives to stand up for what they think is right. I hate to compare this to the time when so many people went along with what happened in other countries, and we look back in history and we think, how could they do this? Well, I think this is a time now where we need to stand up for what's right and not go along with everything because the government authorities say so. Thank you so much. I believe my time is up.
You got a few more seconds, but thank you, Ms. Ferdinand, and we'll be in Santa Maria next week, so if you'd like to still speak on this item, you'll have that opportunity. Supervisor Williams? Supervisor Williams?
Yeah, first of all, I don't think this was germane to the topic, but I'll take the point of personal privilege to respond to the math question. 45,000 people, 45,000 positive cases, divided by the 500 who have died is exactly 1 in 90. It's actually a little bit more than that. So it's maybe more like 1 in 88. But
all right. Thank you, Supervisor Williams. CEO Miyasato?
Chair Nelson, board members, thank you for letting us continue this item. It is a long item, and we appreciate there being a full board next meeting, and we would appreciate if this could be D1.
All right. Let it be, or so be it. So with that, can I get a motion to continue item number 6 to the October?
So moved.
Second. October 12th meeting? Or, shoot, yes. All right. All in favor signify by saying aye.
Aye.
Aye. Motion passes unanimously. And we are now adjourned to the Tuesday, October 12th, 2021, meeting of the Board of Supervisors in Santa Maria. Thank you.